in our schedule. We're going to have Representative Bear join us. And our first order of business will be tribal health issues. I'll hand it over to Representative Bear, or as I say, Walk. Chairman Bear from Joint Appropriations Council
Join us.
Committee. Good afternoon, Senator or Representative Bear.
Order of business will be tribal health issues. Representative Bear. So as I say,
Mr. Chairman, I'm just trying to get the feedback to stop here.
Good afternoon, Senator Representative Bear. Order of business will be tribal health issues.
Mr. Chairman, one moment, please. I'm going to try to shut down the Zoom. I think that's the problem here. There we go. Mr. Chairman, thank you for having me here today. I'm the chairman of Joint Appropriations Committee and glad to be here to explain the budget activities that happened a little over a week ago and how they might affect your work. And so specifically, we're working on account 471. I think it's come to the committee's attention that an exception request for $58 million was rejected. And I'd like to explain that and try to help the committee understand and answer your questions as well, if that's okay with you, Mr. Chairman.
Thank you, Representative Bear, and welcome, Senator Giroux, this afternoon, also on this call. So I think one of the main issues that we had for the committee was the $58 million in federal funding that probably is on most of the people's minds this afternoon. Chairman, if you could kind of speak to that.
Absolutely. So this program has been fully funded since 1995, and I will start by saying that it will be fully funded into the future. It is a 100% reimbursement rate from the federal government for any activities that are taken care of on the reservation by reservation staff in the Medicaid realm. And the base budget going into this budget was $92 million. And what has happened is over time, the amount of expenditures have exceeded that in a biennium. In the previous year, 2025, the expenditures were $62.935 million. And so you can see with a biennial budget of $92 million, it won't cover the full 2 years. So in an effort to alleviate the need to have a B11 request, and these are just accounting terms, this is how we account for making sure we get the account fully funded from the federal government, to avoid having to make a request without the legislature's approval. That's what a B11 is. The agency asked for additional spending authority in the future. And that's what the $58 million is. It's this additional spending authority. Without that authority, they simply do a B11 and notify the legislature that they're going to spend the money. And then they get the reimbursement after the activity is taken care of for the tribal member. And that, again, is fully funded by the federal government. So we see that rates have been going up and down as far as the increases and in future rates. And so in 2021, the increase was 8.35%. In 22, it was 23.31%, quite large. Then it dropped all the way down in 2023 to 2.19%. And then in 24, it was 9.94. Last year, it was 11.4%. And just this week, we received what we believe is going to be the percentage increase. And it is 3.12%. So you can see we went from 11.4 down to 3.12%. And this is from the federal government, these percentages are. So that 58 million was a guess. It was a guess at 10% because we had been at 11.4. And it turns out the guess was a little overestimated. And now that we have the federal numbers at 3.12, the actual number is $41 million. So that is the proper amount to add to that request. And I can tell you the JAC is likely to take action before we get into session to ensure that we accept that new estimate and that we go ahead and give that spending authority to the chief executive and to the department. So really, this is an accounting issue. Now, I just wanted to explain what would have happened had we not given that spending authority. Then the chief executive could still do what he's done for the last 10 years that we haven't made this adjustment, and that is that he would do a B11, and the department would ask for that B11. And that's how we've made it through these different funding shortfalls in the past. And the federal government, every single time, has met those requests. And again, theirs is a reimbursement at 100%. So I hope that explains. I can go into further detail if you'd like more detail.
Thank you, Chairman. Senator Salazar.
Thank you, Mr. Chairman. I can only speak for the Senate. I appreciate Chairman Bear's comments, but I can tell you that I'm very confident that the state Senate will fully support whatever the Department of Health's number is. And I also believe that that will be put into the biennium budget actually before session. So thanks.
Thank you, Senator Salazar. Is there any other questions from the committee? Well, Senator Giroux, do you have any comments or?
Thank you, Mr. Chairman, and good afternoon. And thanks for letting me take a second. I am thrilled beyond measure at the good chairman's comments, both Chairman Bear and Chairman Salazar. As someone who was in the room at the time, I'm like I say, that explanation was just super helpful. And so knowing that this is going to be fully funded, and I'm not going to get into all the stuff about B11s and do we like B11s and do we not like B11s and what the governor wants to do with them and what we're trying to do at JAC. But the bottom line is, and I think for your meeting today, because I know you've got a big agenda, I've been listening all morning. It's been very, very, very interesting as always to listen to the concerns of our tribal friends. But I'm just immensely gratified after a 9-3 vote against, as one of the people that voted for it. I'm just thrilled that this subject is now off the table and that this fully funding is going to occur, is going to pass through, and is going to be there. And I'm just thank good Chairman Bear and good Chairman Salazar, and look forward to making sure that happens with you. And just couldn't be more appreciative. So thank you, Chairman Posey, and thank you, Chairman Case. And I'll let you get back to your meeting. Be happy to answer any questions.
Thank you, Senator. I too am pleased. I realize the all-inclusive rate the number is still going to be settled in terms of what that amount will be, but it sounds like it's in terms of being reconsidered and relooked at. It's the money or the funds is needed at our Indian Health Service, our contract health services facilities, which has historically been underfunded over the years. But we appreciate all the work and help that's gone into this decision. Senator Case. Oh, Chairman Case.
Thank you, Mr. Chairman. Very pleased with the progress that we have. I understand that there's a new memorandum from the Department of Health that revisits the exact numbers that are needed. And I'm wondering if maybe the committee could get a copy of that report, or if it's available to be supplied to the committee. I am aware of that report, so I've actually seen it, but I want to make sure it's available to be given to the committee if that's appropriate. And I don't know, Chairman Bear, would that be all right, or Chairman Salazar?
Yeah, Mr. Chairman.
A lot of chairmen. It's like in MASH. Remember that scene when they go, Captain, 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 Captain? Yeah, Chairman.
So to both chairs, I will make sure you get those documents.
Okay, great. Thanks.
Mr. Chairman?
Chairman Bear?
Thank you, Mr. Chairman, if I may. I just want to make it really clear that the funding was never, ever in jeopardy. These are accounting issues that we're trying to work through. And I think we're getting our accounting cleaned up, and that's really important. But never was the full funding from the federal government based on these adjustments ever at risk. And I just want to make that really clear.
Any other questions from the committee at this point? Representative Altman?
Thank you, Mr. Co-Chairman. Just more of a comment, and you can see with the amount of people that are in this room and the amount of media coverage that things like this get, that this committee is very important to have these discussions so that we can get people to know what's going on, and also even in the legislature to get us all to understand how things work. So I just want to thank you and this committee and also the appropriations team for the work that everybody's doing.
Thank you, Representative Altman. And I don't know if there's any more questions for Chairman Bear or Senator Giroux at this point. Is there anything from the committee?
Mr. Chairman, I'd be happy to stay on if you have public comment that might want to inquire of me.
Oh, that would be fine, Chairman Bear.
Back to the agenda. Shall we go back and pick up our agenda?
Yes. At this time, on our agenda, we have One River Healthcare and Warren Valley Healthcare, I guess. Mr. McAlpin and Mr. Brannon could come sit up here at the table, please. Good afternoon, gentlemen.
Okay, how are you?
Oh, brother.
Stay away from them. We'll get jealous.
Angus. We got One River Cares to start the agenda here. Mr. Brannon?
Okay, thank you, Mr. Chairman. I'm the Chief Executive Officer for the One River Family Community Healthcare. And we currently have 4 clinics. We built a dialysis unit just down the street. We're also working on opening a clinic in Lander. It's just right below the hospital. And basically the reason why we did that is so the patients that are discharged from the hospital have a very convenient location to pick up their medications. And you know, it's very hard for me to try not to show my emotions because I'm about ready to cry because Medicaid means everything to our patients. Without it, we couldn't provide the health care at the levels we are, but we continue to build off of that Medicaid funding And it's allowed us to build infrastructure. And in order to have a healthcare system, you have to have clinics, you have to have all kinds of various infrastructure. You have to hire physicians, dentists, behavioral health, mental health counselors. And one of the areas that's very important to our operation is we have a transportation department. It's very expensive. We don't get any return on it. It's basically, it's just basically a cost center. But what we do is we go out and people call, we go out and pick them up at their houses, and then we take them to the clinic, and we take them back home. And then we have a considerable amount of patients that are referred outside of the state. We take them to Denver, Salt Lake, University of Utah, and the Billings Clinic. The reason why we do that is because of the poverty that our tribal members are confronted with. A lot of times they either, don't have the money for the gas, or they don't have reliable transportation. What we do is we pay for the motel room, we pay per diem, and we take them and they go and see their doctors. This way, we can ensure that our patients are receiving the best care that they can. And the main thing is access. Okay, within the One River Family Community Healthcare, the number one priority is quality care. The second is access. And every decision I make is based on balancing quality with access. You can have as much access as you want, have your provider see 50 patients a day, but your quality is going to be terrible. And vice versa, you could, spend 8 hours with one patient and not have, no access. So, it's, you got to try to find an equilibrium where it, comes together. But I would like to thank Chairman Beard personally, because he has made my day. And Senator Salazar, thank you so much. And I am so grateful because without the funding, our people would die. Okay, we are either the lowest or the second lowest funded tribes in the nation in terms of the IHS system. I get $8 million of direct funding to serve over 10,000 patients. With that $8 million, I'd be able to hire 18 employees, which, what would I hire? Secretaries or, it basically is not fair. We're not funded fair, but it's all based on history. They don't have a formula or any variables, because I searched many years throughout when I was a councilman. But I guess in closing, I don't want to take all the time. I apologize, but the major focus of the One River Family Community Healthcare is preventive health. We currently have we have considerable amounts of pediatricians. We have 4 obstetricians. 2 of them can do C-sections. But what we do is if a patient is addicted to methamphetamine or having a difficult time, what we do is work with the lady or the young person, and we make sure that they get the proper prenatal care, so the baby will be born at a weight that is healthy. Now, everybody talks about the $2 million babies. Okay, that's what causes a $2 million baby is lack of prenatal care. And that's, that's what we're trying to do is spend money wisely, but also save millions of dollars in the future. We started a small wellness for peds, looking at preventive health, and then we are going to build a wellness center for our adolescents, our teens, a basketball court, and what has helped us to do that infrastructure is the money that we make from Medicaid. And Medicaid does not give that money to us. We earn it. We see the patients, we have to code, we have to bill, and then we wait for the accounts receivable to come in, and then, it comes into our general fund. But it's not given to us. It's not a freebie. It's part of the federal government meeting the trust responsibilities to the Northern Arapaho and Eastern Shoshone tribes. And I've always, kind of had an issue with CMS money coming through the state. And I go to Washington and I tell them, we don't have treaties with the state of Wyoming. We have treaties with the federal government. But their response back to me was, well, we've always done this historically. We've always went through the states and allowed that. So I guess in closing, I thank you all and God bless you. And, when we're family community healthcare is a will of God. He is the one that's running it, not me. I'll be honest. I can't, I have to give him the credit and I have to give him the glory because he's the one. And I'm not a Jesus freak or whatever, but that's the actual truth. So thank you for allowing me to speak. Yeah.
Thank you, Mr. Brannon. Is there any questions at this time for Mr. Brannon? Thank you for your words and your explanation. And you can wait because we'll probably have some questions here in a bit. Mr. McAlpin.
Good afternoon, Mr. Chairman. My name's Angus McAlpin. I'm the CEO at Warm Valley Healthcare. I'd like to echo Mr. Brannon's comments about the importance of Medicaid funding. Our compact funding, also $8 million, covers approximately 35% of our total budget. Medicaid funding is very, very important to us. It is really, truly the lifeblood of what keeps both facilities running. I'm happy to share some accomplishments from Warm Valley. We are a new facility, 18 months old. We started with 58 employees, now up to 99 employees. We are about to finish a clinic expansion in mid-February. This will increase the number of exam rooms that we have from 14 to 26. And with that should come some expanded services in cardiac stress testing, infusion capabilities. We've also been able to resume some clinical services that had been in jeopardy with the transition to a tribal facility, namely pediatrics and obstetrics. We are also in the process of bringing on a new electronic health record. We are excited for this as it will most certainly improve patient safety as well as distributing information. We'll be going live with this next month. I'd also like to highlight some of our partnerships in the community. We are partnering with the Tribal Health Program for diabetes education, optical services, and transportation. Doyanatsu, or Eastern Shoshone Recovery, and Warm Valley Behavioral Health will be collaborating. This is a natural partnership, and we are very excited for that. We are working with Head Start for medical and dental services. We have put providers in Fort Washakie schools. We have both a medical and a behavioral health provider. We formed a new partnership with the University of Utah. We have a full full position staffed by a University of Utah pediatrician. Not only will this allow better services at Warm Valley, but it will link us with the University of Utah and specialty pediatric care. We're very excited for this. We've had some introductory discussions about collaborations with the University of Utah and having a visiting child and adolescent psychiatrist for very needed psychiatric services for our youth. And then lastly, both Wind River Cares and Warm Valley will be pursuing a joint venture project for new facilities, probably 4 to 5 years away. So thank you, and I'm happy to take any questions.
Thank you, Mr. McAlpin. And it sounds like healthcare continues to evolve for services on a reservation. And I agree with Mr. Brannon that transportation is probably one of the biggest factors in relation to rural health. You know, a lot of people have to go to, like you said, Colorado or Billings or Salt Lake, or even getting to an appointment locally. And that's a big issue when somebody has to get there to, you know, for a prenatal care appointment or whatever. So I'm glad that those efforts are being moved on. I know that both tribes now have their own dialysis centers. And I don't know if that number continues to climb or if it plateaued off, or, you know, that was a big need 30 years ago. And we have that service here locally. But is there any questions from the committee on healthcare regarding Wind River Cares? Chairman Case.
Mr. Chairman, yes, I think there's a question in here. I just think we should stop and just kind of savor this moment a bit, not only with the funding for Medicaid, but really how far we've come in terms of healthcare on the Wind River Indian Reservation. And I think of it because my father, he had a drugstore in Lander, and when he retired from that, he went to work at Arapahoe as the pharmacist a long time ago. And IHS was one thing in those days, and it was getting better and better. But I remember Harry Tipton, who some of you remember. He was a physician. He delivered over 5,000 babies in Fremont County, and many were Native babies. And he talked about the progress that had been made in his lifetime of people's health care on the reservation. And it was a extraordinary time from the 1950s into the 60s and 70s and on. And basic indices that had improved, like dental and respiratory, and then we have gone to a whole new chapter, and it's incredible. And my good friend Rick Brannon has been a pioneer in that, to take the Northern Arapaho tribe and do a 638, which I remember when 638 was a bad word. Everybody can remember that. So an extraordinary to now be the largest employer in Fremont County. Okay, I mean, that's all of this is an extraordinary. It's stunning. It's like going, working on a farm and plowing with mules and draft horses, and then having a modern tractor, and you hand that farm to your children with modern tractors and all this. But then we have Dr. McAlpin, who's a good personal friend of mine as well, and starting a program all within a year and I'd like to hear more from him about the challenges of making this transition on that side of the valley. And we just have to stop and think about how incredibly great accomplishments these things are. So, Dr. McAlpin, how is it going really? And how hard was it to come this far? And how far do you have to go?
It hasn't been easy. It's usually there's a lot of prep work that goes into this type of a transition, and the decision to ultimately proceed with the tribal facility came just weeks before the transition. We've had to build everything from scratch, every contract, hire every provider. We had lost, as I had mentioned, obstetrical services as well as some pediatric care. And we've really had to claw that all back. It's extremely difficult to recruit to rural America. I feel very lucky to be in the position we are now. I've worked in lots of places. I want to just highlight the fact that the Wind River Reservation probably has some of the best physicians and providers that I've ever worked with. We're truly very lucky to have this level of quality of providers.
So, Mr. Chairman, when I was a little boy, I would go to the Arapahoe Clinic, and it was down below the school along the river there. And I remember the offices were tall. The entire clinic, it was more than one building if I remember right, but the entire square footage was smaller than this room that we're in now. And it was very primitive. But I'm just stunned by this. I don't know. Congratulations and Godspeed. And what a wonderful thing to learn that we're going to get the money today. And thanks to the Appropriations Committee. I can't even begin to say what a good day this is. I yield.
Any other questions from the committee? Comments? No, I know that health services is always evolving. It's a dynamic process, but I really have faith that things will get better. Of course, funding is a big issue, as our early discussion was, and it's and my appreciation to Senator Salazar and Senator Chairman Bear also for their efforts to relook at this and get some more funding for our healthcare services. And I think it needs to be restated that, as you said, we are members of a sovereign nation, but we're also citizens of the state of Wyoming, and sometimes that gets kind of gray area, but we also citizens of the county and citizens of this great nation. So we appreciate your gentlemen's efforts to, healthcare is the umbrella that covers everything in terms of economic development and personal growth and quality of life, and I appreciate your efforts because sometimes we sometimes take those actions for granted, and we really don't know how those affect us till we get sick ourselves or one of our loved ones gets sick. So thank you for your efforts and your time today. It's truly appreciated. Right now, we also have David Myers from Shoshone Tribal Health. There's extra chair per David.
Good afternoon. Thank you, Chairman Posey, Chairman Case, committee members Alman, Salazar, Barlow. I won't take up too much time. I'll just talk a little bit about the programming, tribal health. Again, before Title V, we were a 638 program. We're receiving very limited amount of money to operate. Talking around $260,000 a year to operate a CHR program, which was designed to support our IHS clinic at the time. Some of the things that were brought up, transportation being probably the biggest one, community health workers, which are community health outreach for patients or clients for the clinic, into the homes, and providing some of those outreach services, resources, and so on and so forth. We always had a vision when I started with the program. How do we strengthen those services and those resources, and really build on what can be more effective communication wise with our clinic? The challenges were at the time was of course IHS and the bureaucracies of IHS and so on and so forth. It wasn't the relationships or the communication. It was really just the challenges to work together through those types of formats, which created a lot of challenges for us communication wise to work together during that time. During our recent year in the Title V, those communication, those chains of working with our providers and working closely with the clinic has definitely changed dramatically over the last year. It has opened up a lot of doorways and pathways of us interacting with our clinic and truly doing what was intended to, the outreach for our community and get our community members to our clinic for those services. But again, the money hasn't changed. The funding is still the same, but the growth needs to happen. And this is kind of where the third party, if we can tap into that and have some sustainability, and that will help us grow some of those efforts when it comes to transportation. But our communication and where we've grown as a program has definitely really taken off over the last year. And we look forward to this year really strengthening and building those lines of communication, how we communicate together through EHR systems, how we work together with our providers, how we create that continuum of care and being part of a care team for our community members to try to limit that frustration of community members having to find means of transportation, means of clinical care, and try to take that from them and us managing that for them, so they just have an appointment and they get the care that they need. So those are the things that we want to move into for in the future, working with our clinic, and also to train our own. The one good thing, I guess, the one thing that had opened up doorways with our Title V was, first it was a CHR program. So the challenge was CHRs were designed to do the outreach work and then provide some transportation if needed. But what tended to happen was they became more overly predominantly transportation. And so the outreach work wasn't being done. And it was a missing component. So what we were able to do was divide that focus on just hiring transporters for transporters, and then taking a CHR and putting them into that workforce of community health workers. The University of Wyoming had a community health worker component where my community health workers have completed some training and so on and so forth, and sustainability. So those are billable services. Unfortunately, right now under the behavioral health component. So the challenge is to how can that be a billable service under the outreach and the clinical component, because that's where it's really needed to keep that work going. And also in return is to train our own people to be community health workers, to be transporters, and even that behavioral health component. Transportation is a lot more than just taking somebody to their clinical appointment. You're transporting people that are not in a good position. They're not feeling well. They definitely bring a lot of, the things that they're working through in their lives. And oftentimes our transporters aren't trained to handle that type of information. And it can be a challenge for them. So redesigning our transportation program, not just to take somebody someplace, but to also provide them training so they're able to console and support our clients as they get to their appointments. And that's just the CHR program. I mean, I can go on and on. Our trouble health program has over the last 5 years done a lot of work on infrastructure. 2025, about midway, we finally completed about 4 years worth of work of infrastructure for a new facility that ranges from all supports for our internal programming, cancer program, tobacco program, the community health workers, the diabetes education program, the special diabetes team, We also work with Good Health and Wellness in Indian Country for plants as foods, and how do we utilize, what we've known for many years is beneficial for the health and well-being of our tribal members. Bring back some of those cultural components. Of course, transportation. And then also, again, we have a diabetes educator. So that's a huge billable service for us, to offer one-on-ones, referrals from our clinic and our providers. Utilize that to build classes, cohorts, diabetes cohorts. Our special diabetes team has done a lot of work in the health and educational component, having a fitness center that's open for community members way into the late hours to early morning. We opened that facility in 2023, and the fitness center hasn't closed its doors since day one. It's been open all through the holidays and pretty much 365 days a year. So consistency in our health and well-being is a key component too, as well, with a lot of the work that we be doing. So I've been very fortunate to be a part of this and to have an opportunity to bring forth education and prevention and promote self-awareness and self-health for individuals to take control of their health, not just we're there to support and there to find resources and bring forth anything that our community members are dealing with, but we really want to change the mindset and the outlook on what that means to them personally. So those are our goals. We'll continue to work hard and grow. We were able to build a track and field, walking track and field, a playground, which was brought forth earlier about the Recompete grant. That was the Recompete grant. It has an elder playground, ADA compliant playground, and kind of a specialized fitness playground too as well. All these places are fenced off, and the reason why they're fenced off was to get our community back gathering outside again and to be safe. We have such an issue with dog bites in our community and an issue with dog attacks that we wanted our community members to be safe and have a fenced area where they can get outside and enjoy being together without worrying about the animals. That's a bigger issue for sure, but this was just a way to counter the best way we could so people felt safe to be outside. What else am I forgetting?
I think you got
But I look forward to streamlining our services and find some sustainability. I think the third party is what I'm working on this year, now that the infrastructure is done, is our programming, that workforce component, like Mr. Brandon has been working on to start growing our own and building and try to find jobs for our community members and our tribal members so that, we need nutritionists, we need diabetes educators, certified fitness instructors, CNAs. I mean, these are all things that if we can reach that component of having a training facility to do that in our community, that is our goal. Thank you.
Thank you, Mr. Myers. Any questions or comments?
Sorry, I do have one more thing. The one thing we have on our site that will go live actually in February is we have 2 harm reduction machines within our community. They're like vending machines. We've been working on them for the last 3 months, and we're hoping that our community members will have access to these harm reduction machines, which houses Narcan, fentanyl test strips, hygiene products, condoms, of course, and gun locks, and the list can go on and on, but that's kind of the component we're working on now. One is in one of our community centers, and then one is in our tribal health building in itself. So I know I worked with Dr. Harris to help us get these 2 machines into our community. So we'll keep track and see how this goes. We're connected with OD maps, so we utilize OD maps to see what is reported on Narcan use. It only tracks what is reported, as far as overdoses and so on and so forth. But we're definitely tracking to see if the harm reduction machines make an impact in our community, and how we monitor that and so on and so forth. So that's another thing we've been working on for the last 6 months, I think.
Thank you, Mr. Myers. I got one question, I guess, is, and you guys that work in a health area know how important it is in terms of mental health. You know, it's veteran services and the umbrella of addiction and some of those types of things. How are you guys addressing some of those mental health concerns in our community?
What, well, basically what we're confronted with is historical trauma, contemporary trauma. Historical trauma is like my grandmother passed it down to me. The issue is get the identity back for our patients. They're Northern Arapaho, Eastern Shoshone. Get them to know their culture, get them to, speak their language if it's possible, and teach them the history, and teach them the values that we have as Northern Arapahoes. My grandmother, when I was growing up, I was lucky to have her for 100 years. But she asked me, what does it mean to be Arapaho? I said, I don't know, Grandma. She said, respect and love. And you support each other. And those are supposed to be our two highest values, is love and respect. And, unfortunately, sometimes you don't see that. I was talking to Icky John C. here, and we had a meeting, and he said, respect will cover all of the 10 commandments. Well, allow all of that to come into reality. We have 60% of our behavioral health patients are children. We have it's called a Sacred Child Children's Home. That's part of our practice. And what we do is we take care of court-ordered placed children. What we do is we have our pediatricians go on and see the children once a week, and then we have our counselors go on and see them also. We also, the Arapaho tribe has a language immersion program for young children. They're currently trying to get that spread to adults. But that's the most important thing. Know your culture. Know who you are as Northern Arapaho, because that makes you resilient, your children resilient, where they don't want to drink or they don't want to do drugs because they know who they are and they're proud. And that's a history that they carry on. And it has been able to, prevent a lot of drug use and alcohol use. I have somebody I love, and he was, drinking quite heavily, and he told me, he said, the reason why I quit drinking is because I read about Arapaho, and I found out who I was. And it's just, it seems like it's simple, but it's very difficult, because a lot of our ancestors or a lot of our old people, our elders, have passed on, and we still try to carry on what we can, but it's difficult, it's hard, but that's the most critical thing, is love and respect. And they always, Rappos always pray for a good long life. It's, the same with, like the Episcopal Church or the Catholic Church, they have their ceremonies, they have what they believe in. They brought us that religion. I remember when I was a young child, everybody would go to church, and the little girls would wear little frilly socks, and but what vision I was given of Arapaho people was a pristine house painted white. There was a porch on the outside, and there was a grandma and grandpa sitting there, rocking. Mother and father were also sitting there. And you could hear all of the little children, they were playing on a swing set and everything else, and the shrills and the happiness. And there was a picket fence for them as a protective shield for them. And, that's what makes life worth living, is to hear the little children laugh and seeing older people that are sick, and then next time you see them, they're healthy. That's the best feeling in the world. Healthcare is very hard because you lose a lot of people you love, but you just keep continuing on. So that's why our average age, median age of our tribe is about 21 years old. It's because the Arapahoes don't live that long. And that's what we have to get that, or we can extend the lives. And I had a nurse practitioner working for me. She was my clinical director. And she was leaving back to Chicago. And she said, Rick, if you want to improve the health of the patients you serve here, extend their life expectancy. So that's kind of what I've been trying to do. So thank you.
Thank you, Mr. Branham.
I know, everything's just like with the Title V is kind of growing with our program. Not with our program, but with the components. And you talk about behavioral health, and I can't speak fully on Kelly's program, but Doyinatsu and Kelly's program has taken the reins on developing that behavioral health component, that support and that recovery process. She has a big project with the tiny homes and working on aftercare programs and so on and so forth for community members. That I think she incorporates culture and traditions within some of the aftercare and the teachings and recovery process of what she's working on. So I think she's doing a really good job on definitely targeting that behavioral health component, along with the clinic too as well, and some of their processes.
I agree. That's, I think the project that I'm most excited about in terms of improving behavioral health and recovery services are the collaboration between these three programs. It naturally makes sense to put recovery with behavioral health. As an IHS facility, we were simply not able to collaborate, and to be able to reframe behavioral health in a culturally sensitive way, I think will have a big impact on the community, or that's my hope.
I thank you, gentlemen, for your insight of what's going on and what's ever evolving. Is Lee here, Mr. Chairman?
Chairman, can I just say one quick thing? The transportation is always a key thing. I got three transporters currently right now, and that's basically all my program can afford. And then 3 transporters are trying to do the best they can for whole clinic. So if that puts anything into perspective, you got 3 transporters that are trying to do all the outreach work and all this stuff. It's a lot of strain, a lot of stress on them. So definitely having a knowledge and availability of grants or anything that could help support that type of program, that would be really good for us as a program to start building that type of program. The other thing that I have, and it stems from, and it's kind of a public health thing. It stems from at the time when our trash and trash services got disrupted during those types of deals. When people kind of didn't have no place to put trash, what we're seeing now are people burning trash, and that's a huge health issue because you got people that have asthma or people that have autoimmune, things that they deal with. And when you have a lot of smoke in the atmosphere, chemicals, stuff like that, it causes a huge risk for individuals in that lifestyle. So I know that's a bigger issue to tackle, and I know that's something that whether or not I just wanted to bring it to light because that is, I feel, an issue when it comes to health concerns and respiratory issues and so on and so forth. Thank you.
Thank you, Mr. Mars. Next, we'll hear from Lee Spoonhunter, who's a National Indian Health Board delegate from this region. Good afternoon.
Good afternoon. Thank you, Mr. Chairman, Chairman Posey, Chairman Case, and distinguished members of the committee. It's good to see you all again, and I'm glad to be here in a lower capacity. And I represent the Billings area and Rocky Mountain region on the National Indian Health Board. There are 12 of us in the country that represent the 12 regions. So I represent all of the Montana and Wyoming tribes. Just to kind of give you a little bit of background on the National Indian Health Board, NIHB stands as the united voice of the federally recognized tribes dedicated to advancing health and well-being in Indian country since 1972. NIHB has provided a critical advocacy, policy analysis, and education to support tribal sovereignty and strengthen tribal health systems. Based in Washington, D.C., NIHB offers a wide range of services from legislative tracking to training and technical assistance, ensuring that tribes have the resources and information they need to navigate the complexities of healthcare policy and public health. Rooted in its mission, NIHB collaborates with tribal leaders, federal agencies, and partners to fulfill the trust responsibility and secure quality healthcare for American Indian and Alaska Natives communities. Some of the things that we have been working on at NIHB, as you are all aware of on the federal level, our work is mostly on the federal level at NIHB. The enhanced premium tax credits that expired recently, we worked hard to try to advocate for those. We are working on HHS Secretary Kennedy's IHS realignment, so we are watching that really closely and working with our tribal leaders to make sure that this IHS realignment will work for all of our tribes in Indian country. We were also working hand in hand with our Congress on the Rural Health Transformation Program, which I know there was money awarded to the state of Wyoming, and the Eastern Shoshone and Northern Arapaho were stakeholders in that plan that was submitted to the federal government. Today is a good day. I just want to say that I am, like Rick here, happy and a little emotional that the healthcare money was put back into the budget, or is going to be put back into the budget. It's very critical. I just want to bring up, I sat on 2 HHS secretaries, tribal advisor committees for over 5 years. So I've seen 2 secretaries come in and worked with them on a national level as a tribal leader. And Rick is right. Out of the 574 tribes in the nation, the Eastern Shoshone and the Northern Arapaho are the second lowest funded IHS tribes in the nation. And that is a fact. The statistics are out there. I can get them to the committee if you guys need them. And also in the Billings area, and I and Rick have been to numerous meetings to get this changed. And Rick is absolutely right. There's no IHS formula of how tribes were funded and how it was allocated, and what magical number does Congress come up to fund the tribes out there in Indian country. There are 10 tribes in Montana, and there are 2 tribes in Wyoming. So when Billings area funds the tribes, 10 funding levels go to the 10 tribes in Montana. 1 funding level comes to Wind River Reservation, and that 11th share has to be split up between the Northern Arapaho, Eastern Shoshone. So this money that was put back into consideration to be passed for our people, this is why it's very needed and is very crucial. And so we thank you today for putting that back in there, because for us on the Wind River Reservation, this is a matter of life and death. If we don't have this money that you all are going to pass back into the budget, people will die. Northern Arapaho and Eastern Shoshone tribe members will die, because that's just the honest reality of the inadequate health care that we face. But here at Wind River and in Montana, for some of the tribes, those who've entered into 638 compacts with IHS are self-governance, Title V compacts, agreements. You see the tribes expand their health care, because the tribes are resilient, and they take what little federal funding they have, and they're able to take that money and build on that to provide the services that our people are needed. You know, this is a work in progress, healthcare, especially in Indian country. And it's something that we at National Indian Health Board, as a board, and our staff there are very committed to make sure that we continue to work so that healthcare in Indian country is where it's supposed to be, because it was a federal trust responsibility to begin with. So I could go on 10 years from now, but I'll quit there. And thank you all again. It's good to see everyone.
Thank you so much, Mr. Spoonhunter, and thanks for serving on such an important board that looks at these issues in Indian country. Is there any other comments?
You might
Well,
make room for public comment for people.
Yes,
to come
we'll go
forward.
with public comment now.
Thank you.
Thank you so much, gentlemen.
Representative Larson is here.
Oh, Representative Larson?
Public-
Yes, come on up.
Need to make a little bit of room.
Representative Larson.
Thank you, Mr. Chairman and members of the committee. It's good to be with you today. And as I've listened to the comments today, as one of your colleagues and a member who served on this committee for most of the time that I've been in the legislature, I was hoping to bring back a little bit in perspective our responsibility as the state and as legislators, and how that's historically come to where we are today. Because as we continue these talks, it won't be the end of similar misunderstandings, if you will, and so we really rely upon this committee to make sure that there's a good understanding of the needs of our citizens who live on the reservations and of those 2 sovereign entities. And so I'd like to go back and just remind everybody that and I know that Rick talked about this just a little bit, but in the Fort Bridger Treaty for the Shoshone tribe in Section 10, it talks about providing a doctor. The federal government's obligation to the government of the Eastern Shoshone tribe, this government to this government, to provide what has been determined health care. Similar language in the Fort Laramie Treaty and pretty consistent amongst all the treaties of the federally recognized tribes. And that had been determined to be an obligation to provide health service to the citizens of those sovereigns, whatever tribe that may be. That wasn't always funded real well. So in 1921, in the Snyder Act, it provided for consistent funding, which was a huge step forward, but the funding was still inconsistent. We put it along there. In 1956, we created the Indian Health Service. And as Lee talked about, that the distribution of funds to the various tribes had been very problematic through the history of Indian Health Service, and particularly here on the Wind River Reservation, where that 11th share had to be divided between two tribes. I might add, Chairman Case, thanks to you and some work that we've done in the CARES Act, we were able to get the Treasury to provide funding to each of those tribes separately, which was a big coup and a big start forward, and we hope that that continues on. But because the Indian Health Service funding wasn't real good, in 1975 with the Self-Determination Act, the tribes were allowed then to do this 638 contract. That, as they come out of the blocks, there was some stumbling and some falling, but the tribes, as they've got their feet under and have been able to provide those services that have typically been provided by the federal government for themselves, whether that be irrigation, whether it be healthcare. Now, that leads us up to a conversation, Chairman Case, that you recall was when Wind River Cares was being created. They are saying our funding the reimbursement is not adequate for this underserved population. And we worked to get an 1150, thank you, an 1150 waiver, which would allow to increase that funding through Medicaid to those Medicaid eligible people to our tribal health providers. And that included IHS at the time. We made that application. That application is still in front of CMS. It hasn't gone away. There were some flaws in that application that the state and CMS has worked through, but about a year or so later, even though we had been using this all-inclusive rate since 1995, CMS come back and received an assurance from the state of Wyoming that they would provide that 100% pass-through to tribal health care providers. That kind of satisfied the need of that 1150 1115 waiver. Too many numbers for my old head, but satisfied the need for that waiver. Now, so then the federal government really, in an effort to try and satisfy its treaty obligations, federal government to the sovereign nation of the Arapaho tribe and sovereign nation of the Eastern Shoshone tribe, says we will reimburse you for a 100% for all the services that you provide to those of your members that are enrolled in Medicaid. Now, this was a big deal for the state, and hats off to our Department of Health, who is very tenacious about looking at ways to make the dollar go further. Because if up to this point, those members of the tribe who are enrolled in Medicaid, and many of them weren't, were getting reimbursed on the state rate, half, 50-50, and at a cost to the state. Mr. Brandon kind of educated, there's another way to do this better. And so now, those members of the tribes that are enrolled in Medicaid get reimbursed 100%. And if there's a service that a local hospital or even in Casper, a service that they provide that these two facilities don't provide, if they refer them to that hospital, as you noted, Senator Case, they too can be reimbursed 100%, and that's a savings to the state. It's a big dang deal. But the feds have said, because we're going to reimburse 100%, we get to choose the rates. That's our choice. And state, we're just passing it through. And so in my time on the legislature and on the appropriations committee, we would receive these rate adjustments for the encounter rates. And it also includes Morningstar Manor, our long-term care provider out there, as well as these two facilities. And we've increased the number of people enrolled in Medicaid, and we would periodically get this rate adjustment. And it just came and we passed it. They're authorized to bill for it. If we had denied this money, we would still be obligated to pay for it. You know, and so that was problematic. So I think that there's been some conversation that, or some who would suggest that, well, we didn't have the true numbers at the time when the budget was presented. But if you listen to the testimony, which I did, that is not the case. Not at all. What we was told by the person who presented that amendment was that it was an effort to save taxpayer dollars. And even though these weren't general fund taxes, they were federal taxes and we needed to save them. So that effort, in my opinion, was short-sighted at best for not understanding what this money done and how it came across, but I think very deliberate to two sovereign nations violating their treaty and our treaty obligations to one population. Really, really not right. Now, guilty of charge. I've made mistakes in my life, and to come back and say, got it. We made a mistake. We'll put the money back in, right on. That's the thing you need to do. But accept the fact that we made a mistake, because we didn't know when that budget is presented, that budget was based on the information they had at the time to make an estimate. And only after this was denied and time went on, did the federal government come out with the actual numbers of what that would be to these two tribes. And so now we know what the actual number is to do an amendment, which the amendment is being drafted. Senator, I've got that taken care of. And hopefully that'll be done. So along with that, there's two other components of the budget that this committee needs to be aware of. One that Dr. Alphen pointed out in the relationship between the Warren Valley healthcare system and the University of Utah. We also have in the Rural Health Transformation Fund a provision there that we will start providing funding for 5 seats at the University of Utah Medical School, which would also include psychiatric, which is very beneficial in working with the tribes as preceptors and residency placements. So that's really exciting. The other thing that we talked about that you heard Mr. Meyer talk about is this behavioral health component and how working on the health of the whole. There's a provision in the budget because we haven't rebased mental health provider reimbursement for Medicaid for about 10 years. Now, we're required to, as former speaker, good friend Barlow remembers, we do it for the DD providers and we do it for a couple of others, but like dental, we don't do it, and periodically we have to catch up. The mental health providers getting reimbursed on Medicaid for mental health services has not been rebased for some time, and we have in the budget $3.5 million to bring those rates up, because these guys get reimbursed for services to their members who are on Medicaid, but they also serve other members of the public and can bill Medicaid for those services. And so for the health of their business model, having that enhanced adjusted rebasement for Medicaid for mental health services is also important, as well as every other mental health provider that bills Medicaid, takes Medicaid enrolled patients, gives them that boost to where we have more providers that are willing to do mental health services for those people on that. So, Mr. Chairman, I just think it's really important that we understand where we're at as legislators and how that fits into this whole scheme of thing between the obligation of the federal government and to these two sovereign nations, and then how we work with these two sovereign nations as our fellow citizens of Wyoming. And I think this committee's historically worked really hard to do that, thanks to Rick and, you know, these Lee and all of the tribal council, Kim Harjo's back here, all of these good people that we've worked with. Thank you. So I'm happy to answer any questions.
Any questions or comments?
And Ivan Posey, so I'm reminded, 11:15 and Ivan Posey. Thank you.
Chairman Case?
I would just like to thank Representative Larson for working on this issue. And I really feel that it's important that we kind of take the politics out of things like this and really try to get down to what actually it's about and what we can do and where the money comes from and what it's for, and, you know, really have a factual discussion, because when we all have facts, we can make better decisions. And it's not about policy, it's not about politics. Facts drive the deal. Representative Larson brought facts today, and I'm grateful.
Thank you, Representative Larson. Council Lady, did you have some comments? Council Lady Harjo, come on up.
Thank you, everyone, and thank you for having us today, Ms. Altman, Ms. Salazar, Mr. Case, Mr. Posey, and Mr. Barlow. The discussion that we're having today is a really great discussion. It's bringing a lot of facts to light that no one didn't really know in its entirety. I think some of it may have been taken out of context at certain different kind of conversations. But for me, I want to talk about the communication part of it. Right now, I was appointed to the Health Resource Support Service and Administration for families, and it's a tribal advisory council. We cover all kinds of areas within the healthcare, and right now, what I see in our little area here is we have a lot of life flights, and that really affects a lot of the people in our communities, not only on the reservation but in Riverton, Lander, surrounding communities. Right now, we're all talking about funding. And I think if we all put our minds and our money together, that we can get really good people in our hospitals, so we won't have to send our people out. So the money that we have here stays here in the state of Wyoming, instead of going to Denver, instead of going to Billings, instead of going to Salt Lake. Those are the main places that our people get life flighted out to, because they have the expertise there. And that's something that we really worked hard on, is getting a lot of experts here so we won't have to send our people out. We know it's hard. A lot of our people do not have transportation. So that's really a big, big deal for us. Even with our clinics, we're really going to start working with the Wunderberg Transportation Authority. I have some stories. They're quite long, but there was a young lady that was wanting to apply for a job. It took her 2 days to get to Riverton from the reservation. And that's just one of the things of communication and transportation. One of the things that I like to bring forward is that we create an Office of Indian Affairs at the state capitol. I think that the communication would increase a whole lot more. We would have regular meetings and all the facts would be there instead of things here, said here, things said there. And we could really open that line of communication between the tribes and the state. Right now, I don't see that. There's a lot of other tribes in this nation that have a great line of communication with their senators, their governor, their representatives, but we're not one of them. To me, we're just now starting. We're just now starting on that path here, especially with this tribal select. And I'm glad that it's open. I'm glad it's open for the public to come and make their comments also, because we have to hear from everybody in order to make things better for the rest of us. And as Northern Arapaho people, we share a lot of things that we have, a lot of stuff a lot of food, medicine, our homes, and a lot of the things that I'm talking about are all related to health, housing, food sovereignty, those kind of things. And right now we're sitting in a rural area where the big cities may get their food, but are we? Are we going to be able to be on that food chain, not only for the tribes, but for the rest of our communities? So those are some of the things that we have to think about and talk about for the people that live in the state of Wyoming. And that includes all of us. So I think that we need to have more collaboration and a better line of communication. And you've heard a lot of the stuff on health issues today, and I stand by what everyone here has said. So thank you.
Thank you, Council Lady Harjo. Councilman Glick.
Good afternoon, Chairman, Chairman, and committee. Thank you for allowing me to speak today. I'm Clinton Glick. I'm one of the Eastern Shoshone Business Councilmen. I worked in the tribal health, and then I worked along with emergency managers, like Lynn Bud and them, anyway. One of the things that I noticed with health is if you got a good healthcare system, it creates resiliency. One of the things is there hasn't been much push for resiliency within our reservation. It's been kind of left to its own for years, but I know nowadays that the state works with both tribes. And one of our issues with resiliency is trying to get stuff from like metropolitan areas to our area in a time of need. That's one of the things. And that comes to another place where I worked was transportation. It takes a lot of good transportation to get things to and from. Now, one of the problems with our transportation was, like a couple of the other individuals said, I think it was Lee brought it up, we're always represented as one tribe for both tribes. So we always got half of the money for each side. And it's still like that, even though we're two sovereign nations. Now, that's one of our formula issues that's with the federal government, is the way that it's put together. We have our own EIN numbers, but yet we also have EIN for intertribal. So that's one of the things. One of the things with our transportation problem out here is FTA doesn't allow for certain types of transportation because it's not public. It's not considered public transportation. If you're trying to transport dialysis patients and clinical patients out of state. It doesn't account for that because it's not public transportation. When you do have reimbursement for transportation through Medicaid, minimal. That it takes a stack of paperwork just to get a little bit of your money reimbursed. So that's why we never even messed with it, because it would cost us more money and more time than what the return was. And when I worked for transit, I used to be the transit director, and even with the FTA, like Albuquerque and like Denver and New York City, all these big old transit programs, even though they charge a rate, their return is only like 3% back of what the 100% spent. Our problem on a reservation is a few people, but a longer distance to go. So it costs us more to travel to pick up one person to take him to the clinic. Like if you're in town, you can go across town, pick them up, bring them right back. If you're on a reservation, sometimes from Fort Wasky to Owl Creek's on the other side, Hamilton, you know, 2 hours, 2.5 hours just to get there, and then another 2.5 hours to get back. So it's a little difficult, and it's a little challenging because the federal formula doesn't account for distance. It might in a sense, but it doesn't. They don't realize that we have to pay the $8 a person, and I mean nowadays $15 a person to drive that person over there. In a city, you can have 10 people you're picking up on the way over there, dropping them off the 10 back this way. We only got one way over and one back. So the labor considered within that formula should be set higher for rural areas. And I know you guys aren't the ones that set that, and I just thought maybe you could push it up the ladder. That's all. We have always had issues like that with our small population and large land base. So it's just something to think about. It's not like, and I know that when I went to Billings and we were talking to a lot of the people that work with IHS and work on the formulas and stuff, a lot of their big money goes to these metropolitan areas like Albuquerque, Phoenix, stuff like that. We don't get the big hospitals or the big clinics up here. There's a waiting list. You got to wait years and years to get a hospital. And more than likely, you're not going to get it up north, but luckily we're getting something like that. So we're moving ahead. It's just that we're not, it's hard because I know that we have such a low population, and that's the biggest hindrance on our formula. Thank you.
Thank you. Good to see you.
Yep, good to see you too.
Thank you, Councilman Quick. Is there any other public comments on healthcare? Chairman Grossbeck.
Good afternoon, Chairman and representatives. I'd just like to thank Senator Salazar, you, Senator Case, Mr. Beard, and Larson for his taking us to school today. You know, it's good information that needed to be shared, and for giving us the funds, because like what you heard Mr. Spooner say, sometimes it's people's lives are on the line, you know, and I'm glad that the fund is going to go through. Hopefully, be able to see it go all the way across the finish line, and it'll be good for our people. Not only for our people here, our Northern Arapaho, Eastern Shoshone, but for the surrounding communities. Funds do go up to the surrounding communities, to Lander Memorial, Sage West hospitals. Funds do go there too, you know. So I just want to thank you guys. Yeah.
Thank you, Chairman Grossbeck.
Do we take a break?
Yes, one more comment.
Oh, sure.
Ms. Wagon?
I got it? Okay. Good afternoon, ladies and gentlemen. My name is Nicole Wagon. I absolutely support our healthcare, our treaty rights, as you guys can see today, that we protested today with the Action Committee. On a personal, my daughter, Tiana Wagon, has been type 1 diabetic 23 years. She was the first diabetic type 1 that young here with our reservation, and there's been more. But life got better when we got the insulin pump, and that's like pancreas outside of a body. So I've always advocated and supported Mr. Brannon on these endeavors for healthcare overall for everybody. Leave nobody on out. But that's a disease within itself. And it's really hard. You don't know what somebody goes through. You don't know internally what they go through. But I thank God every day that my daughter's here and alive with me. So it's inevitable with healthcare. It's a human right for all my Indigenous relatives, all our people, Native and non-Native. But with that being said, all the other issues, diabetes, cancer, we're losing our people at a high rate. And it's heartbreaking, heartbreaking. And I'll share with you that I recently, the good Lord had mercy on my family again. I'll testify to that. And my daughter, the electronics failed her, and she went into a low blood sugar. And may I call it mother's intuition? But I went and checked on her. And if I didn't, she wouldn't be here today. I would have lost another daughter. So with that being said, they worked on her, stabilized her. She's been in ICU for a couple of weeks. She's out, leveling out, and I'm so grateful that she's here with us today. And she's been an advocate. I could share with you, at 8 years old, this little girl advocated in Washington, D.C. And Mr. Brannon asked her, and she spoke. This came from a child's voice. And she said, yes, I'll testify. Only if I can wear my jingle dress. And that was simple. And that was a great ask. And her little voice at that time made a difference. And when my daughter gets tired of carrying that extra cross, I take her out to Wonder Cares. I tell her to look at the building, because what she did was help with expanding the facility, which enabled more people to get that health care. That little girl, one voice at 8 years old. So I just want to share that with you. Again, my name's Nicole Wagon, and I applaud you guys for being here, listening, and with my testimony, I am grateful. And thank you for the change. Thank you.
Thank you, Ms. Wagon. There's no more public comment on the health issues. Diane Mitchell.
Greetings, everyone, again. Diana Mitchell here. I would like to make a comment because I would like to state that the 1868, I gave a legislator letter. The 1868 Treaty Article 10 provides a Shoshone health care My father and great-grandfathers always had health care. When the Shoshone tribe went to contract 638, the Shoshone Business Council never communicated with tribal members during the process. During Shoshone General Council, the Shoshone Business Council ramrodded the 638 contract through Shoshone General Council. I was there in attendance. This action by Shoshone Business Council hurt the tribe. No doctors, there were no dentists. I have a friend that was a double transplant. She was all worried about her doctors. What's going to happen? And if the tribe would have stayed with Indian Health Service, this would have not happened. The Eastern Shoshone 1868 Article 10 provides for Shoshone health care for Shoshone people. Contract 638 could be used for extra health care needs and expenses. Because when I'm familiar with Contract 638, okay? That it's a good program. It is. Good backup funding for health care. If you want to fix up your buildings, maintenance, you know, health issues, stuff like this, it's a good thing. I really support that, but not going to total contract 638 healthcare. That's a treaty right given to the Shoshone people. And we have some treaties here. We have two treaties, the 1868 and the 1863 and the 1868. They are ratified through Congress and still enacted, okay? And in the 1868 treaty, it has health care. And I want to think that the Arapahoes did receive health care when I was young. Because like I said, I've had health care all my life. And my dad before me. And because the Arapahoes got health care, okay, through the Shoshones, then if it wasn't for the Arapahoes having a specialist, okay, when I was young, because I got very, very sick, my dad took me to different doctors, took me to the IHS at Fort Washakie, and took me different places, couldn't find out what was wrong with me. And then he took me over, he heard that the Arapaho clinic had a specialist there. So he took me over there. And then when that specialist saw me, he said, "Oh, put her in the hospital," because I was dying. I know how it feels when you're gonna die, okay? So, you know, that healthcare is important not only to the Shoshones, because it's a treaty right, people. This is given to Chief Washakie and the Shoshone chiefs for all their help. You know, they help with the westward expansion, if you know history. And this is something that we always will have. And healthcare is one of them. And there should be no question. And just because the council was foolish to go to contract 638 totally and then not tell the people and had them all stressed out, I'm upset about that. Old people, people that were sick, I'm advocating for that. I'm speaking for them because that was wrong. No communication with the general council and then ramrodding it through general and not listening to the council members when they want to have a comment. But anyway, I support the contract 638 for extra health care. But for the Shoshone, Eastern Shoshone tribe has Shoshone health care. Promised. Signed by Congress. Thank you.
Thank you, Ms. Mitchell. There's no more public comment on healthcare. We're going to take a 5-minute break. 5 minutes and we'll resume with a law enforcement jurisdiction panel. Thank you. We're waiting for a couple committee members to come back in, but our next agenda item, when we're running a little bit late, is panel on overlap and law enforcement jurisdiction. And you gentlemen could come sit up here since you gentlemen will be presenting. Okay, we're going to go ahead and get started again. And it's a panel on overlapping on law enforcement jurisdiction. So if you gentlemen could state your name and your agency, and then we'll get started here.
Thank you, Chairman Posey. My name is Major Thomas. I'm the Field Operations Bureau Commander for the Wyoming Highway Patrol. To my left here, I have Lieutenant Travis Hauser. He is the local Troop I commander here in the area. So I brought him along today just in case there was something maybe specific for the area that the panel might have a question about. But generally, I'll just cover the topics at a little bit higher level. Thank you.
Good afternoon, Chairman Posey, members of the committee. I'm Justin Kempf. I'm the FBI supervisor for the western side of the state of Wyoming. I cover our Lander and Rock Springs offices. I've been in that position for slightly over a month now, but I previously served as a case agent in our Lander office working violent crime cases on the Wind River Reservation from 2015 to 2020. I consider that work to have been some of the most impactful work of my career, and I consider myself very fortunate to be a part of that work again. So thank you for inviting us to be here today.
Well, we appreciate you gentlemen coming in. As we all know, the Wind River Reservation is so, I guess, has so much jurisdictions overlapping, whether that's a highway patrol, whether that's a county sheriff, whether that's a BIA, you know, the DIA, DCI, yes, the DCI, Department of Criminal Investigation. So all those overlap when it comes to jurisdiction on tribal land. And it's been on our agenda it's been on here for a while, just to see how coordinated efforts are. And, you know, it's almost, sometimes as a tribal member, our people that live on the reservation, it seems like sometimes we don't get the information we need. Whoever handles whatever aspect of that jurisdictional issue. But I know that continues. Here at the college, we run an interagency law enforcement group, and it's just made up of all the jurisdictions, BIA, the sheriff, BLM, Forest Service. And it's not really chaired by anybody. It's basically just an update type of group, and it's been in existence probably 15, 20 years now, and we meet quarterly. And I think the law enforcement has always been of the aspect or the opinion, we'll help each other out, and we'll figure out the jurisdictional stuff later on. But I guess it still continues to be a quagmire at times in terms of information sharing and some of those types of things. So is there any other comments from the committee before we ask these gentlemen to go ahead and present? Whoever, you got the floor.
All right, thank you, Chairman Posey. Thank you, committee members. So last time I was here, I talked a lot about kind of how we handle the jurisdictional issues with the BIA Special Law Enforcement Commission that our troopers go through, attend that training. It's been a challenge, and it still is a challenge to today. Right now, currently, we have 6 of our troopers here that are not certified with that BIA certification, and 5 of them that are. The process is it just takes a long time from the training attendance to getting all the paperwork in from background investigations, and then finally getting the credentials issued to that particular trooper. The last class that we had, you know, we had the government shutdown kind of hit, and then that class was canceled. So that set us back a little bit, but we're just looking forward to, once that's rescheduled, we can get those troopers into that training and hopefully keep that process going. Our staffing here in our Troop I location here for Fremont County, we're full in this area, which is one of our rarities across the state. We still struggle with vacancies statewide, but here locally we're doing well with our staffing, which is a benefit to the community here, whether it's on the reservation or in the Riverton Lander area. I know that every month we sit and have a staff meeting with our district captains and our executive command staff and go over our activities across the state. And our lieutenant here, Lieutenant Hauser, is very proactive in this area and usually one of their top troops as far as the work generated, as far as his contact with the community, his traffic enforcement, and whether it's criminal interdiction efforts, and then also partnering with our federal and local agencies there and any kind of initiatives that we have moving forward. We're still part of the DUI task force, which that's up and running, and that now has been going on for several years. So that's just something that we'll be part of moving forward. Here recently, we are moving to expand our involvement in the Safe Trails Task Force. Here, particularly to the reservation, we're looking at expanding and adding another 5 troopers to that task force that are part of our canine interdiction team. They live outside of the area, but they will be part of that task force so we can bring them in periodically to help saturate the area whenever there's any kind of special initiative or details or local events coming where we need to bring in extra law enforcement. As far as a question that was asked last time I was here and addressed the group, I believe it was Representative Ottman asked me a question when we were talking about troopers that don't have the BIA credentials, and we run into that problem where we may initiate an enforcement stop. The individuals that were stopped are enrolled members, and we don't have the authority to enforce any kind of a statute with them on the reservation in those circumstances. The question that you asked at the time was, how many cases have we had where we run into this issue? And I didn't have that information at the time. And so when I went back and started looking and pulling some data, we just had no way to track that. We weren't keeping any kind of statistics when we run across those kind of cases. So what we did was we did implement some new changes last October to allow our troopers to enter that data into our CAD system when they initiate that contact, if that's the circumstances that they find themselves and there's no other officers there from another jurisdiction to be able to take that case, then they could enter that disposition, and we can track that information moving forward. Since that time in October, what we found is that we've had 20 specific incidents that we can identify where that's been the case. I think that's a little underreported, simply because it's a new system that we've initiated as a result of that question. So it's still an educational thing that we need to still, get our troopers more familiar with that disposition and have them make sure that they're accurately entering that information in when they clear that stop. The good thing about that, about this moving forward, is if it's a public safety issue or concern where we may have, some serious charges, or it looks like the investigation is going to a felony level, or, a DUI or something where there's public safety risk, our troopers are still taking the initiative to reach out to our BIA partners and ask for assistance and see if we can turn that case over to them. But a run-of-the-mill traffic violation, we're probably not going to have the resources to do that, or necessarily pull somebody away from whatever they're working on to handle that, and we would just clear that stop and move on. And so that's where you would see that documented cases moving forward. Another thing that Lieutenant Hauser and I were speaking about specific to this case is in our monthly state stat, what we call that, where we go over and review activity across the state, is adding that particular stat monthly so we can kind of track our tribal citations, and then also the ones that we weren't able to enforce, just to keep that as a metric moving forward in those meetings. As far as any other, as far as the coordination, I think really we're working well. I think we all look at whether we're working on the federal level, the state, local, or tribal. We view public safety and law enforcement as one endeavor, regardless of what uniform we wear or anything like that. So I do appreciate the relationships that we have with our other agencies there, and look forward to continuing that into the future. When it comes to, I know our dispatcher that came up and spoke last time, Brian Kent was here talking about the Shoshone alerts and those particular topics. He was unable to make this meeting today, but did let me know that there was one Shoshone alert in January. That was on January 12th and 13th. That was out of Sweetwater County, so it wasn't a Fremont County case, but the system did work well. We were able to locate the elderly missing person within 4.5 hours, and they were located within Teton County due to that alert. So another success story there, where he was the person was safely found within a short period of time. You know, speaking of our collaboration with the BIA and our other agencies, we did have a call for service that they handled here locally this month on the 16th of January, where we were requested to assist the BIA in a fatal crash involving a pedestrian. And so we continue to do that. We're happy to do that moving forward, provide whatever expertise, whether it's crash reconstruction or whatever other assistance that we can provide moving into the future too. So with that, I'll stand for any questions and turn it over.
Any questions from the committee? So,
Mr.
Chairman
Chair,
Case.
just commend you on your follow-up. That's really great to see. And maybe we learned something by your question and the follow-up to it, Representative Ottman. And thank you. Thank you both.
Thank you.
I had one question that you mentioned earlier where some training had to be set back. Now, is that in relation to the card that is given by the BIA in terms of other, like the Wyoming Highway Patrol, in terms of liability and answering calls on a reservation?
Chairman Posey, that's the Special Law Enforcement Commission that allows our troopers to enforce any kind of tribal or federal law when they're on the reservation dealing with an enrolled member. That's specific to that training that the BIA offers. We just really kind of wait and try to coordinate with them on those classes, and that's just really kind of the initial steps on getting that credential. When it comes to offering any assistance, if there's a call for service where the BIA is asking for assistance, we're gonna respond and act appropriately. They may do the initial case report and charging documents, but we would be there to assist in any part of that investigation that is deemed necessary.
Now that training, as I recall, some of the past testimony was the training may have been held, but the cards were slow in coming, so it kind of hampered some of those. You know, like I mentioned, the law enforcement officers were going to help each other out regardless. But I think that was a thing of getting those cards. Is that still an issue?
That still is an issue. We have a couple troopers that have been through the training and are working their way. They've had the background investigation, but they're still waiting for those credentials to get issued, and it's been well over a year. So it's just a very slow process that has to be accomplished here before that's issued.
Mr. Chairman, I always go political on the answers, so be careful here. Is there room for our congressional delegation to help with speeding up that process with respect to those cards?
Chairman Posey, Senator Case, I don't know who the contact is for that. As far as I know, that our professional standards staff is the one that works through that background and making sure that documentation is submitted. I would have to follow up with that section to see who that is that might be able to have that point of contact.
Senator Lummis's staff is present at this meeting right now, and one phone call sometimes helps a lot in lots of things.
Thank you.
You have the floor.
Thank you, Chairman. I thought it might be helpful just briefly to give an overview of what the FBI's jurisdiction is, and then we can discuss how we collaborate with our partners for those cases that involve multiple jurisdictions. So just by way of background, the FBI is responsible for investigating the most serious crimes that occur on the Wind River Reservation, to include homicide, child sexual and physical abuse, assaults resulting in serious bodily injury, DUI fatalities, and others. In order for us to have that jurisdiction, there are essentially 3 criteria that have to be met. And when we have those 3 elements, we investigate these matters without regard to age, gender, or any personal demographics. So the first criteria is we need a predicated criminal act for which the FBI has a federal statute. And there are specific statutes that give us the authority to investigate the violent crimes I just described when they occur in a tribal community. We don't normally investigate homicides and child abuse outside the reservation. Those statutes are specific to our work in tribal communities. So we have to first have a criminal act that meets one of those statutes. The second element that we need is that the crime has to have occurred in a tribal community, so within the exterior boundaries of the Wind River Reservation. This is generally fairly clear for us. There are certain parts of the reservation where if a crime happens to occur on a boundary or in land that may have been deeded or sold to a non-tribal member long in the past, where there can be some needs for additional legal expertise. When we have that situation, which thankfully doesn't happen very often, we will respond collaboratively with our state, local, and tribal partners, and we'll work that jointly until we resolve or until the attorneys resolve which court is most appropriate to handle that case. So that starts with that initial collaboration from the beginning. The third element that we need to have federal jurisdiction is at least one party, either subject or victim, needs to be a tribal member. If they are both non-native, that's not going to be in our court. So if we have all 3 of those things, then we have a federal or a potential federal violation to investigate. It's important to note that we do not make the charging decisions. Just because we have a federal crime does not mean that it always translates into a federal prosecution. That rests with our partners at the U.S. Attorney's Office. We are the collectors of fact. We collect evidence presented to them, and they ultimately make those charging decisions. So that's a brief overview on what our jurisdiction is. In terms of how we collaborate, you heard that we often work cases jointly from the beginning, and that those relationships have been around long before I first started working here. But they did become formal or more formal in the establishment of our Safe Trails Task Force, which I believe came to existence in 2020 or 2021. Through that task force, we provide federal deputization for both Title 21 drug investigations and Title 18 federal investigations for our state and local partners. This is a tremendous force multiplier for us, as it gives us additional resources to surge a response to, say, a homicide or a critical incident. It also allows us to ensure that we are collecting evidence from multiple jurisdictions appropriately. I recall as a case agent long ago where we had a case where a victim was assaulted, kidnapped off reservation, brought on the reservation where he was ultimately murdered. And we had searches in both jurisdictions. We had interviews that had to take place, evidence that had to be collected. And it was through those relationships that we were able to bring about a successful prosecution of 3 individuals in that case. So that Safe Trails Task Force is a tremendous resource for us, and we welcome any additional officers or agencies who may be interested in joining that.
Thank you, sir. You know, the issue of people within the reservation is sometimes we don't get enough information. You know, some crime may happen and we don't know what goes on with it until we maybe read it in a U.S. Attorney's newsletter, you know, that this person's been prosecuted or whatever. But I think that and I think that's probably the case of multi-agencies working together. I think with the federal government, they're more tight-lipped, I guess, lack of a better word, in terms of getting information out. I know the BIA is bound pretty close by that, as opposed to, say, the city of Riverton are the city of Lander, which could publish arrest records on a daily basis. Sometimes on a reservation, we lack that in terms of victims of crimes and follow-up to victims of crimes. So it continues to, I think it's gotten better over the years, but I think it still lingers there at times.
Sure. Just to follow up on that, Chairman, our victim services component, they really play a vital role in trying to be that communication bridge. And certainly it's never perfect, but it is something that we place great priority and emphasis on. And even though we can't maybe speak publicly because of the sensitivity of an ongoing investigation, we do tend to lean forward quite a bit in our meetings with victim families, keeping them certainly aware of any ongoing proceedings that may appear in the courtroom or in the media perhaps. And so while that information may not be as broadly dispersed publicly, we do try to maintain that type of communication with our victim families as much as we can.
Mr. Chairman.
Chairman Case.
And Mr. Chairman, following up a little bit in terms of courtroom proceedings, my understanding, and I might butcher this a little bit, but it's not the law enforcement, it's at the U.S. Attorney's level, but there are pre-sentence investigations that in state crimes are made public, are available, and it's routine. It's required by the court. In other states, that's a piece of law. Now, I'm not talking about all pre-sentence investigating. I'm talking about ones that can be released. In Wyoming, my understanding is that we don't explicitly permit it under the law, and so that it's more routine to have some of these pre-sentence investigations not be public. And I may have butchered this a little bit, and I apologize, and if you can help me with my question better. But we are looking at a proposed change to the Public Records Act in this session. And we've been told that if we would permit some of those things to be a public record, that federal authorities would honor that in terms of activities in federal court within the boundaries of Wyoming. Can you help me with that? And have I totally butchered it, or have I gotten it kind of close?
Chairman, to the best of my ability, my understanding is that currently the pre-sentence report, which is typically prepared by U.S. probation, goes to the judge and the court for consideration, but is not public. I think for any changes there, discussion there, probably going to the U.S. Attorney's Office or United States Probation Office would be the best point of contact.
Representative Bachman.
Thank you, Mr. Chairman. Hello, Mr. Fegler. Just to clarify again, because I remember it was part of the conversation previously, when there are happenings on the reservation, how many people are in your office? And do you, if it qualifies as something that your people should cover, does that go over the tribal police? So I'm wondering how many officers you actually have. And then also, is it still happening that your bureau is multi-state so that different officers are pulled to one state and then maybe come back? Or how does that work? Do you have permanent residents here?
Sure, committee member. We currently have 5 special agents assigned to our Lander office who work almost exclusively investigations on the Wind River Reservation. They are all assigned here permanently. Some of them do take transfers, as I did after 5 or 6 years, and go on to other assignments. But generally, our folks are here for multiple years. In some cases, they may spend an entire career here. In terms of our response and work with Wind River Police Department, we will have every week, one of our agents will be the on-call agent for that week. And the Wind River Police Department dispatch is aware of that agent and their cell phone number. And so typically the way our cases begin is a 911 call comes in, and dispatch may recognize immediately that it's going to be a felony level offense. So say it's a homicide or use of a deadly weapon. And so dispatch, as they are dispatching their tribal officer, may immediately call our on-call agent, who will then respond to either the crime scene or to the hospital to talk to the victim. Or if it's a case where there's some uncertainty as to what exactly has happened, the responding tribal officer may go to the scene, start talking to some people, and then he or she may learn, oh, this is going to be a federal case, and then they will call our on-call agent, who will respond and begin working collaboratively with the BIA. We function in a lot of ways like a detective would on a police force in a metropolitan area. That's helpful.
Yes, it is helpful. So from the time, is it because of the nature of being federally taken care of? Does it take more time than it would if it was local officers?
I mean, I think that would probably, you're asking if it would take more time to prosecute or to investigate to prosecute. That'd probably be more of a question for the U.S. Attorney's Office. There are, certainly different rules and procedures, and I'm certainly not an expert in the state judicial system. So that's probably better addressed to someone else. But in general, I will say over the course of my career, there are different processes in place for the federal judicial system that can sometimes cause things to take longer, although I've also seen cases that are charged very quickly when the situation dictates it.
I just thought of this, not to overreach my bounds, but just to, I had heard that there was a sweep about 4 or 5 months ago on the reservation. Just whatever information that you could give about that.
Sure. The public information, that was a number of search warrants that were executed by our Safe Trails Task Force, and it was in furtherance of an ongoing investigation.
So I think to follow up on that, your agency would do the investigation. It's then turned over to the U.S. Attorney, who works with the tribal court system to decide if that would go to tribal court, or if it's under the Major Crimes Act, it'll go federal, which usually involves a grand jury indictment, right?
Yes, that's correct. And oftentimes, every incident has its own unique characteristics, but in a typical scenario, the Wind River Police Department responds with that uniform officer. Our on-call agent responds, and they begin collectively working the case. And there often may be enough evidence at that time for a tribal charge to be brought. And so that individual may come into tribal custody right away, and that process starts. And then in the meantime, we are putting together our case, sending evidence off to the lab, interviewing witnesses, and building towards a potential either complaint or an indictment.
Now, the Victim Services program, I know the BIA has Victim Services, the FBI, the U.S. Attorney. How close do those coordinate? I was just wondering because, if a case, say, well, they think it was a federal case, but it went tribal, do those agencies work together to let the victim know what happened?
Yes, that collaboration happens all the time. Typically, if an FBI agent is responding as the on-call agent, he will be responding with a victim advocate as long as they're going to be dealing with the victim. So that happens from the beginning. And then once a case has been charged in federal court, there'll be coordination with that U.S. Attorney's Office victim witness coordinator who can provide some of the more details regarding court appearances and schedule. As far as the tribal victim advocates go, they're often involved, from my understanding, very early on, much like our victim advocate is, and play an important role in helping connect victims to social services, domestic violence shelters, and other resources that are an important part of our service.
One more is, last time we met with youth services at our last meeting, there was the comment of that there's an uptick in younger crimes, people younger committing crimes. I see that across the state of Wyoming and Casper and, Cheyenne and some of those places. Do you see that more on the federal side also?
So again, I've only been here for 1 month, so it's a small data set, but we do deal with juvenile crimes or juveniles involved in crimes on the reservation. It does happen. I don't know that I could speak to necessarily a long-term trend. That would probably take some more analysis. But I do think it is an important thing to keep in mind and to consider. We are pushing to do more outreach in the schools, putting on presentations, whether it's internet safety or even recruiting events. We're looking at doing a teen academy, hopefully later this semester. And again, trying to help the youth in the community maybe find more positive outlets for their energy.
Thank you. Is there any more comments from the committee? Well, we thank you, gentlemen, for your efforts to, I guess, try to streamline the system, although we understand there's barriers. And, you guys have a tough task sometimes, and we appreciate your help in terms of making our communities a little safer. I realize it's draining, and you guys got mandatory retirement age and some of that stuff, but we appreciate what you do. Is there any public comments on law enforcement jurisdiction?
I think we got one right in front.
Yeah.
Hello, I'm Diana Mitchell again. I would like to let everybody know that I was working in the BIA, Bureau of Indian Affairs Police Department about 1970s, okay, as a dispatcher, and I was trained as a detention officer, okay? So I know what happened with this law enforcement stuff. I have an idea. Okay, so the treaty is the supreme law. We have Article 1, bad men. Chief Waskey put that in for a reason, because we're experiencing a lot what's going on. But the BIA police has never, I say never, been financed. Federal government has never provided the amount of money that the tribe needed to run the reservation, the law enforcement. When I was working, there were only 10 cops, 10 policemen, okay? And sometimes not all of them were working. We have millions of acres to cover, okay? So because the federal government and the councils didn't support the treaties, that's what they should be doing. And that would give us more money through the federal government for law enforcement, because that's what we need. And we need a law enforcement center. We don't need the police over there across the street. They need a law enforcement center with a what is it called, to keep the cars, like they do in the city. We're not the third world here, even though we do act like it at times. But I do know that the federal government hasn't been funding the Winter Indian Police Department, okay? And when I was working there, the reason why I was working there is because Archie Keat, he was the first FBI that I knew of, because he asked me to come to work there, okay? And he lived there. He lived in the White House on the compound. And they had a pretty good system, okay? They had a juvenile officer, which was Richard Ferris at the time. Okay, so they had a pretty good system, but not enough police to cover the millions of acres. And that's a treaty violation. They should provide those fundings for the BIA, Indian Police. And then, may I say, once again, the state patrol, highway patrol has no jurisdiction on the Shoshone Wind River Indian Reservation. They didn't back when I worked there. They had no jurisdiction. The only time that the sheriff and the highway patrol could come on the reservation is when they had a permit and they were called. They did not patrol the reservation on a regular basis because it's sovereign land, treaty land, okay? It's supposed to, the federal government's supposed to provide us some law enforcement here. We've had to go through 10 cops, what, how many? I bet you they're still operating with 10 cops, 10 policemen. And that's not right. That's not right at all. And I think that the state needs to respect the treaties and understand that the Shoshone Wind River Indian Reservation is a separate country. That the Shoshone Business Council, the Shoshone General Council, they are the ones that decide the laws. And speaking of the laws, we haven't even got to see all of our law enforcement, our law and order code, ordinances. The people don't even know what they're living on, what laws. I know because I have only seen 4 ordinances that has been passed through General Council, Shoshone General Council. And how many ordinances have we had? And the council said, oh, we'll bring these laws in front of you guys so you'll know what you're going to live under. And they have not done that. They fail the people. But like I said, the Highway Patrol does not have jurisdiction on the reservation on different roads. The only roads they have is a highway going to 287. Now, 138, 132 is, it can be done, but not as a patrol, because that's the BIA's responsibility. If the federal government would give money to the BIA for more funding for policemen, and then you need to train people that come here, you know, like that. These highway patrolmen, do they know our culture? Have they been orientated? Like when we had the Rangers come over here one time, and they were throwing elders on the ground because they had, medicine bags hanging. They thought it was drugs because they didn't know the culture. So is the Highway Patrol, do they know the culture of the Shoshone tribe? Do they know that the Shoshone General Council is a supreme law? And when they get together, 75 quorum, then that is the law. They decide. But please have the federal government fund the government, the BIA. That's what's been the problem. Heck, back in the late 70s when I worked there. So that's the problem, no funding. They don't honor the treaty like they should. If they honored the treaty, we wouldn't be in this situation. We'd have the law enforcement because they would fund it. Congress, you know, somebody needs to go to Congress instead of asking for strangers like ICE, have money for our cops, our policemen, so we can hire more people. And thank you for your time.
Any other comments? Mr. Garvin.
Yeah. Operate this thing. My name is Mike Garvin, and I'm a tribal member, and I'm like Miss Mitchell here, that we're a sovereign nation, and I'm kind of interested in this card that this guy is talking about. You know, how they got a, what, can you explain that card to me that they're applying for, or they have to receive? Because I'm like Miss Mitchell, you know, it's like we're tribal members, we're supposed to be sovereign. We have the highway patrol, we have the sheriffs, and we have the BIA all out there looking at us. And so the highway patrolman is talking about a card that, can you explain that to me?
Yes. Because of the multi-jurisdiction on, there's the Riverton Reclamation area around Kinnear. There's obviously the Wyoming Highway Patrol has, on the main 287 and 132. They used to cover Rendezvous, but that was turned back over to the tribes as well as 17 Mile. But the card allows, it's through the BIA. It's a federal training that they get and they receive a card. So they're covered in terms of liability. If they go and something happens to them, they're covered insurance-wise. So that's what the card is. Because as you know, as Diana Mitchell said, we have been at a loss for enough BIA police officers. I'm not too sure how much we have now, but I think I'm explaining this right. It's a federal training where they get a federal card that gives them liability if, say, there was a three-car pileup or a shooting or whatever, and they gotta respond, whether that's a county sheriff, the highway patrol, to assist the BIA, So it's more like I mentioned earlier, the police officers are willing to help each other out, and they'll, as they say, they'll deal with the mucky mucks later, and in terms of jurisdiction. But I think that's the card that is a long time coming. Like the gentleman mentioned, Mr. Thomas, is that some have been waiting for over a year for the card. So that hampers some of those cooperative law enforcement efforts that may happen.
Okay, so when I'm pulled over, do I ask them for their card? Or what happens if they don't have that card? Or do they have jurisdiction over us? If they're not issued that card yet, do they have jurisdiction?
Mr. Chairman?
Yes, Mr. Kevin.
And the troopers are still here
I know.
too, so we could hear firsthand from them. But my understanding is it's more than liability. It's also conveys jurisdiction in a limited jurisdiction for the area that they are and that they're entitled to patrol. And so some of them have it and some of them don't. Many have applied and haven't received it. So when they arrest a person without that certification, they can't arrest a native person, an enrolled member. So they either have to try to get collaborative law enforcement to come, or if that's not possible, and it's a simple traffic violation or whatever, they get to go. Do I have it right? Have I messed up the liability versus jurisdiction? And please, Mr. Thomas, thank you, Mr. Chairman. It's sensitive. And thank you, Mr. McGarvin.
Chairman Posey, Senator Case, thanks. So what the Special Law Enforcement Commission does is give the trooper the authority to enforce your tribal law, where they would cite the enrolled member into tribal court, just like a BIA officer would. Without that, we don't have that authority. So on the surface, if you're looking at a trooper in a uniform, you're not going to know whether they have the law enforcement commission or not. It's going to be, it become very readily apparent at the stop at the time, because our troopers know whether they have it or not. And so basically, if you're contacted by a trooper, it's important to let them know that you're an enrolled member and have that identification on you, so they know where they need to go as far as enforcement wise. So if they have the law enforcement commission there through the BIA, then they know that I need to treat you as an individual through tribal court versus our circuit court or district courts. If they don't have it and you're an identified enrolled member, then they either need to, depending on the severity of the situation, they may need to contact BIA and ask them to respond, or if it's like a traffic violation and we don't have anybody available, then we would let you proceed. Yeah.
Thank you much, because you've clarified something for me, which is really important, and that's jurisdiction. Because that word was never brought up, and now we've decided that if they don't have that card, they have no jurisdiction, if that's my understanding.
That is correct. So we have a, it really depends on whether the individual is an enrolled member or not. So we have that overlapping jurisdiction. So if we have a non-enrolled member that is out on the reservation, then we would still have that jurisdiction and enforce like we would through our circuit and district courts.
And so how many officers do you have that do have that jurisdiction or them cards?
Well, right now we have 11 assigned to this area, and out of the 11, we have 5 that have the certification and 6 that are still waiting for it.
Oh, I'm sorry. Sorry. Okay, Mr. Chairman, I guess. Well, that clarifies that he's saying he has 11, but he only has 5 that's has jurisdiction. And I guess that's all I have is that question. Thank you. Thank you, Mr. Case.
Welcome, and Mr. Chairman, there's an opposite problem too. If a BIA person pulls over, say, an obvious drunk driver, and they're not an enrolled member, it's the opposite equal situation. And so they have to try to find some way to resolve this situation by getting someone else in law enforcement to the scene. And they don't have cards. There's no courtesy extending in that direction. So it's an opposite, but kind of an unequal situation.
Thank you for that, and I apologize. But yeah, I'm not against the law. We do need the laws. Just want to clarify, because I was told a while back that the reason the highway patrolmen were coming here is because the BIA weren't certified in a, what do they call it, when someone dies, that kind of an accident, that the BIA wasn't certified to do that, so the highway patrolman would come out. And so that's been quite a while back. So thank you both, sir.
Chairman Posey. Yes. Bobby Shongutzi here. I just had one question about the jurisdiction. How do you determine that? Because there was a traffic stop on Highway 287 with with a state trooper, and he did call the BIA and they finished the traffic stop. But another traffic stop happened on Highway 26 and the trooper called a sheriff's office. So what determines jurisdiction? Is that on the card, or do we get cards? How do we know as the people who has jurisdiction in what area? Because now a tribal member is tied up in a county court case when it should have went tribal because they were speaking to a tribal member both times. It was the same person both times. And so where is jurisdiction defined in that area? That was my question.
I need help.
Yeah, I miss Ms. Sanghatsi. I think that's kind of our take on having this panel, because it's the jurisdiction is always at question. And I know Chairman Case mentioned earlier, like if a non-enrolled person was pulled over for DUI at Fort Washakie, the BA has no authority over that individual. They have to call the county sheriff to come and get that individual, or the highway patrol. And that's just federal law. You know, the tribes don't have jurisdiction over non-tribal people in terms of law enforcement. Mr. Thomas, you have anything to add?
And just one time out.
Okay.
That's actually kind of a state law thing too, because it had been proposed to extend the courtesy jurisdiction and it didn't go anywhere. And it's not, it leaves a bad taste in people's mouth in this county. So, but anyway, I'm going to yield and let them get back to the previous question. Thank God Mr. Thomas is here to, Captain Thomas, Colonel Thomas. Yeah.
Thank you, Chairman Posey. To answer your question, it's going to depend on who the person is that stopped, whether they're an enrolled member, and then where they're physically at, where did the violation occur. So if the violation occurred outside of the reservation, but you were stopped traveling into the reservation, it's where the actual violation occurred. So that may be, depending on the circumstances of where the incident happened, would determine what that jurisdiction is. So if it was on the reservation and you are an enrolled member and you were stopped by a highway patrol and they called the BIA, then that's perfectly acceptable to turn that case over. I don't know specifically about a county involvement or anything like that, but that's how that would happen. So if there was ever a mix-up on jurisdiction, that would certainly be vetted by the prosecuting attorney if it went into a circuit court or district court. And if it was determined that there was a jurisdictional issue, then that case would be either dismissed or that case would be turned over to tribal court, whether they were going to accept that or adopt that case, and then it could go in that avenue through tribal court. Does that answer your question, Chairman?
Kind of. Because is 287 is the reservation, is 26 in Kinnear Reservation.
Chairman, I don't know the specific boundaries of where the reservation is up here, but it's definitely one that our local troopers here, they're very cognizant of where those boundaries are and the particular parameters that they have to operate in. So I would defer to maybe my lieutenant, if he's still around here, if he knows exactly. Well, I don't blame him on that, but he could at least answer very specific questions as far as maybe where those boundaries are for you.
Thank you, Chairman.
Thank you, Ms. Sangatsing. Thank you, Mr. Thomas.
Mr.
Okay.
Chairman, I think we see that it's really not easy. It's not easy on anybody to figure this all out. So, or to have a nice fix that works everywhere either. It's really too complicated.
It is. That's Ms. Mitchell.
Have the federal government fund the Shoshone tribe for the treaty. Give us more policemen, for God's sakes.
And Mr. Chairman and Ms. Mitchell, I agree, we're the state of Wyoming. We're citizens just like you, and you help to elect the state legislature. We don't tell the federal government what to do. We can't. We're suggesting, you betcha, but we can't do it. Yes.
We're going to move on to our next subject now, which is missing and murdered persons update.
Enforcement.
Okay.
For public comment, is Mr. Forstar on the Zoom? Mr. Forstar, would you like to speak first? Well, to break the ice.
Now, which one are you referring to?
To law enforcement, the law enforcement public comment.
Okay, yeah.
Just to break the ice, I introduced myself to Mr. Kempt, and he's the FBI working just recently for 1 month, correct? And I brought my card, and I consider myself FBI as well. I'm full-blooded Northern Arapaho tribal member. So, just saying, I'm FBI as well. So anyhow, I totally embrace law enforcement. I support law enforcement, work with all agencies through experience with the murder of my daughter, Jocelyn Watt. And with that being said, worked with this Safe Trails Task Force. Eastern Shoshone first funded them, And then they reached out to me for advocacy, and then Northern Arapaho Tribe jumped in to fund them as well. So anyhow, still out there to make a difference within my communities. And I think law enforcement is vital component to our communities to keep our communities safe. And still going at it as a Northern Arapaho tribal member for everybody and leaving nobody out. I've been working with Mr. Four-Star for the past, I would say, 2.5, 3 years. My neighbors in the state of Montana. And people think that you're not doing something or you're not trying to make a difference or to be proactive, to be preventative. And I've been going at it. I've been going at it hard. I'd like to share with you that back in 2024, the Intertribal Council signed off on a resolution in December of working with license plate readers, cameras on the Wind River Reservation with the Wind River Police Department. And I'd like to share with you that I've been a part of that team with Montana. Nobody knew that I've been working with all these agencies. We called it the Tiger Team. So working with all of them, coming together to stop the drugs and alcohol that's coming into the reservation, of standing up and taking a stand and cleaning it up and saying no more. I have been a part of that. So with that being said, it's a component to stop the violence. It's a component to make it safe for all community members. What else can I share with you? That working with technology in the state of Montana, they're planted on every reservation in the state of Montana. Yes, sir. So with that being said, even if word got out to where they're located, it doesn't matter. People have shot the readers out, but technology is so ahead that it was able to catch the individual, and the individual was prosecuted. I think it's time to take a stand to clean everything up. So that is a factor with what's going on within our communities. And we need all the help that we can get to say no more, of having this filter in to our reservation, and that it's not okay. And it's a factor with law enforcement has their job cut out, you know, with what they need to do, how they need to do it, and all these jurisdictions need to work together. And so I've sat down with the best, let me tell you, DCI, DEA, FBI, the state, you name it. And that's how I got justice for my daughter, Jocelyn Watt. So with that being said, going at it, and I applaud the efforts of law enforcement because I'm the one that implemented the Ashanti alert. And every time that alert goes on out, it picks me up that I must be doing something right within the community to make that difference. And it's hard. It's hard to stand on up, to speak on out, but I'll do it. If it's going to be for the safety of others, all the unborn, because all of this needs to be cleaned up, because you got all these people coming in and feeding off our people that are in poverty. And these are all components, and it'll help with human trafficking as well. And I brought Mr. Four-Star, Lance Four-Star from the state of Montana. He goes out diligently to every reservation of advocating and making a difference. And I've been a part of that team because this also is a component of the missing and murdered Indigenous relatives movement to stop the human trafficking as well. So that is here, but I've been trying to meet with Mr. Senator Case as well to start a bill because we need it throughout the state of Wyoming to make that difference, because it's just not coming in on the reservation. This is evidently happening in our county as well. Riverton and Lander, Cheyenne, you name it. You know, drugs and alcohol. They don't care who you are. So I think working together, we need to come together to make it better. And I've supported FBI, cold cases. I've supported them, the state. I was the only Indigenous relative that testified for the missing bill, and people didn't understand because it's inhumane for anybody to go missing. So with that being said, that bill changed for law enforcement to do better, change law enforcement to take all these matters seriously. So I've been working hard and I embrace, again, all my neighbors. And I met Mr. Four-Star up in Montana with the NIAC meetings, the Non-Invisible Act Commission, and I testified as there over there as well. That gave birth to the Missing Murdered Unit. We do have one here. I've been trying to educate everybody about the Missing Murdered Unit. They've been at my walks, this, that, whatever, but all these jurisdictions and all these agencies and victim services, we all need to work together. We need to collaborate together, because I'm not going to put anybody in harm's way. The Missing Murdered Unit, they're based out of South Dakota. That's their region. And they solely focus on Indigenous relatives that are missing and murdered, any kind of tip line, anonymously, this, that, whatever. So trying to get that out and educate the people, that to give them hope that we finally have an agency here. So all these agencies, we have what? The state, the city, BIA, FBI, I mean, all of them, right? And then you look at that one little dot with all these agencies cross-referencing each other. Somehow, some way, they lose focus on that individual. So we need to come together and work together and to make it better. So that's my public comment today. And to get everybody on board, Mr. Chairman, I thank you for your time. And I would like Mr. Four-Star to testify or public comment to educate our communities.
Thank you, Ms. Wagon. Question from Representative Altman.
Nicole Wagon.
Mr. Four-Star, you have the floor.
Thank you, Mr. Chairman, and good afternoon, Wyoming Select Committee on Tribal Relations. For the record, my name is Lance Four-Star, spelled L-A-N-C-E, last name F-O-U-R-S-T-A-R. I reside in Wolf Point, Montana. Thank you, Nicole, for the invite. And yes, on kind of a timeline, before NIAC, we had a little girl here in Wolf Point that went missing, and she was actually kidnapped from a 19-year-old man, and he exploited her. But the community came together. Every single law enforcement agency you could think of, all the way up to probably Homeland Security, from Seattle to Chicago. They shut down the rail lines. I live on the High Line, so we've got a rail line that goes from Seattle to Chicago. They call it the Empire Builder, with the possibility that he would have put her on one of those trains. So the law enforcement had searched Friday and then Saturday. They needed fresh eyes, so the community got together. I helped lead a search. Then just through the process of elimination, we looked everywhere from dumpsters to houses that were boarded up. Through the process of elimination and conversations with people that were familiar with both the victim and the perpetrator, we had figured out that she most likely was east of town at the grain elevator. So on our map that we had placed up on little Macy's grandmother's living room wall, we had crossed out the streets we went through and the houses that we thought she might be at, and then just basically wrote an arrow saying grain elevator. So the next morning, a retired human detection dog from Glasgow, Montana, named Forrest, and his handler came to Fort Peck Reservation, the Fort Peck Reservation, and they went to the grain elevators, and right away, from a sock that grandma had, she had given the dog and the handler a sock. The dog took off on a beeline right to the area where actually our Roosevelt County deputy Sheriff Corey Ream had discovered little Macy bundled up in the cabin or the cab of a work truck out at the grain elevator. So it was great, that she was discovered, but it wasn't great that the things that had happened to her. So one of the things that I testified at NIAC was that this story, and I talked about the anger that I felt when I was invited by the family to the tribal court for the tribal side of the charges for the indictment. Fire alarm went off because of a coffee maker was left on or something like that. And then this defendant, this perpetrator, John Leba, started laughing, and it made me so angry that in light of just being read charges, he had raped and kidnapped a 6-year-old little girl from our tribe, from our community. He laughed, and it made me so angry when we were all evacuated temporarily from the courthouse, and a lot of us that were there were very, very angry, and it impacted me quite a bit. And of course, this was around the time that Savannah's Act and a lot of different missing and murdered indigenous peoples acts, and there were quite a bit more involvements with the movement for the missing and murdered indigenous people movement, and so we created a coalition, like Nicole had said afterwards, through the assistance of the community relation services. They had facilitated, that's with the federal Department of Justice that had been dissolved actually recently, and they're being reinstated hopefully. But the CRS had helped us, Rosa Salamanca. She helped us facilitate some further conversations. I had talked to Senator Tester's staff, and on the call was also some of the individuals from the Montana Department of Justice, specifically Steve Crawford, the bureau chief, and one of his drug intelligence agents, and they had mentioned the fact that there's these cameras out there, and when I look at my notes from that time, and it's still something that there's not going to be a location kind of disclosed. So some of the questions that we had for the press, I had been interviewed, and I needed to get clearance through the DEA bureau chief here. So some of the answers that he gave me were like, what do the scanners do exactly? So the generic meaning of a LPR is of course, a automated license plate recognition device. LPR cameras are advanced traffic sensors used to capture and digitalize images from license plates. This is called license plate recognition. For LPR to be useful, it has to be done in real time, 20 milliseconds or less, and with very high precision, 99% or more. Regular video cameras can't do this. The placement requires Department of Transportation permitting. It's only accessible to law enforcement with reasonable suspicion or official law enforcement purposes. And up here, per Montana policy, records are mandated to be retained for 90 days or less. So under Montana Code annotated 46-5-117, use of license plate reader, prohibited exceptions, definition, the penalty that could be found on montana.gov. And the records are not tied to Department of Motor Vehicles, DMV records, or sold to third-party vendors. And the plate is required to conduct the query, so the plate number. So what this does is when I approached the Tribal Executive Board with Sheriff Boyer from Valley County, the county west of Roosevelt County where I live, our reservation has 2 counties on it, Roosevelt and Valley County. Sheriff Boyer and I, after he had done some research from the Crow tribe on their LPRs and some of the success stories that were given to us by Diesel, which is the Drug Enforcement Administration Special Intelligence Lincoln in El Paso at the El Paso Intelligence Center in Texas. They had given us a kind of a law enforcement only guide or a pamphlet to present to the Tribal Executive Board on the success stories of these across the nation. So at that point in time, there were about 11,000, and now I believe there's 14,000 cameras in the United States. We do have, as of December 10th of 2023, we passed a resolution with the Fort Peck Tribal Executive Board, and one of the golden aspects of this resolution was that the Fort Peck tribes has the option to essentially pull the plug of the program. And another safety feature after many coalition calls including people that were at Standing Rock, the American Indian Movement, some grassroots level activists that were on the calls that were very, very, had a lot of criticism and gave a big critique on the system. And they asked the hard questions, like what's going to happen to this data? Who has access? What if it's abused? Is it going to be weaponized against protesters expressing their freedom of speech, rightful peaceful protest? And those guarantees were that if a law enforcement officer who has supervisory access to the LPR system, say they have a girlfriend that they're stalking basically because they broke up, and he runs her plate 5 or 6 times, a flag goes up. It's flagged in the system, and they Epic Diesel they figure out that the system is being used for malicious purposes, and they can get their access pulled. So there's that safety feature. The fact that there's 90 days, the records will be destroyed after 90 days. And one of the other essential aspects of this is the after we had passed a resolution, we talked about funding. So one of the key ways of getting this funded was, of course, it needs electrification. So not only does it need a signal, but it needs power. So when we talk about power, of course, we're going to be talking to the local electric co-ops to pay for this. But we also had people within the Montana Electric Co-op Association that were very helpful, and actually with their connections with Governor Gianforte's office, they had helped us get over the obstacle of permitting, because there's actually some criticism to this or misunderstanding. But once the guarantees and it was understood a lot better by both sides, all sides of this issue, everybody was okay with it, because essentially what this does is gives law enforcement another tool in their tool belt. But it also one success story that I love to convey. Actually, I'm sitting in front of the Suicide Prevention Center, call for my wife. But I was here after working out at the wellness center down the street. I got a direct message from a friend. His mom got a message from a tribal member from Poplar who was in the back of a black expedition, and unbeknownst to the driver, who had been human trafficking her throughout Texas and Southern California, he was taking her to Tijuana to sell her to the drug cartels. And if he found out that she was sending messages to people, that he would probably kill her. So between 3:30 Right after that, they had explained to me in order to file an exigent request, which is basically like an emergency status. They can access the entire system and look for specific license plate, Texas license plate, JWB, number. And it came up on the system. They pinpointed it down in Chula Vista, California. The further information, it's non-adjudicated, hasn't been completely prosecuted. So what I do know is that by 7:30 that evening, she was rescued. He was arrested, and now she's in a sober living unit in Southern California. But she was a tribal member, so a tribal member filing a missing persons report through the Fort Peck tribes had we were able to access that exigent report and save her life. How expensive is the technology? And why do we choose license plate scanners? And from the advice of the DEA Council, we do not release this information outside of the agency. That's their response. Where else are these cameras set up? The same answer. They don't disclose specific locations. Are they looking for certain license plates? Is there a worry that people could just change out their license plates when traveling through? So the plates affiliated with missing persons, amber, silver alerts, drug money and human trafficking, auto theft, homicide, or fugitive suspects, national security. Those are the type of plates that they're looking for. And can you defeat LPRs? And paper temporary tags and dirty plates are tough to read at times. So yes, of course, if it was obstructed, which is illegal, they could be bypassed. So has there been a huge skyrocket in human trafficking, drug trafficking on reservations? And so I can refer back to the Montana missing people's site. We have over 20 to 30% of our native population in the state of Montana amongst that list, when we only have about 10 or 11% of the million people that live in Montana. So out of that, it's definite proof that there's a disproportionate amount of Native American people in the state of Montana that have gone missing or potentially murdered. What drugs have significantly increased, and what do you think that is? Fentanyl was definitely a huge issue. The price, somebody can get on Amtrak or take a drive over to Spokane, Washington, buy a fentanyl pill for 50 cents, come back to the Fort Peck reservation and sell for $125. So it's highly lucrative for these bad actors to do that. And there's plenty of information, articles, Mexican drug cartels targets Native American reservations in Montana on NBCnews.com. Fentanyl surges through Montana reservations on the same site, NBCmontana.com. Is there a lack of officers on the reservation? And yeah, we all know that on the Fort Peck reservation, there's about 17 officers, and they had talked in the previous discussion, talked about cross jurisdiction and things like that. We do have Montana Highway Patrol, Wolf Point City, Roosevelt County, Valley County, and of course they do need to, on an annual basis, approach the Fort Peck tribes to receive that cross jurisdiction stamp of approval from the tribal executive board. And what that does is, if there are individuals that have kind of violated the comfort or the sanctity of our tribal members on the reservation, our community can be vocal and kind of ask for further vetting if there's some cultural sensitivity issues. So another question is, how do we work together with the states, DEA, and is this helping grow a relationship with the states? They coordinate efforts to best attack the issues facing the reservation. Another question is, do you believe other reservations will join? And they left that up to me to speculate. Of course, we expanded from here to Fort Belknap, who have passed a similar resolution that grew to Blackfeet to Rocky Boy. Now Northern Cheyenne passed a resolution. Crow already had these cameras. And so now we're missing CSKT, and they've got a unique relationship with the state and federal government. So it's a little bit more difficult because I do believe Lake County has their own type of cameras. But the end goal is to have these cameras plugged into Diesel, which is those 14,000 cameras where you can find somebody that's abducted down in San Diego, from Texas, from Montana, from Wyoming. And so the good thing about this,
Mr. Chairman, Mr. Chairman, can we encourage the gentleman?
Chairman Case?
Mr. Chairman, could we please encourage the gentleman to try to wrap it up? We've got lots of.
Yeah,
We
got a whole nother topic.
still have a couple more items to go over this afternoon. So,
yes, Mr. Chairman, I'm finishing right now.
Mr.
We did have
Forstar, if you could wrap it up.
Yes, sir. Mr. Chairman, I was just going to finalize this with the fact that we do have a Tiger Team meeting in the spring in April down in Phoenix, and of course Nicole is at the one up in Montana. So we do have the Rocky Mountain HIDA, Casey Patterson with the Wyoming Information Analysis Team, who was at the last Tiger Team, and Wyoming. We're really proud of the Wyoming tribes down there being a part of this great network. We're also starting to implement the same type of alert that Ms. Wagon talked about, the turquoise alert, that like in the state of Arizona. But thank you very much for your time. If there's any questions, I was a director of the Montana American Indian Caucus for the state legislature, and I'm a candidate for my own House district in the state legislature. Thank you very much.
Very outspoken. So, again, I'd like to thank you all, and hopefully we can work together and work with Mr. Casey Patterson to make change into the state of Wyoming, just for everyone. So,
thank you.
Thank you.
Thank you, Ms. Wagen and Mr. Forstar. We're going to move on to missing and murdered persons update. Who is the representatives to present this afternoon?
Here, I'll slide down. I'll let you start on.
Good afternoon. Whoever wants to take the lead, please introduce yourselves.
Sure, I'll start it.
Oh, sorry.
Thank you, Chairman Posey, Chairman Case, committee members. Again, I'm Justin Kempf with the FBI supervisor for our Lander and Rock Springs offices. In terms of an update on our MMIP work, in 2025, we published a summary, which is available online through our FBI website, that provided an overview of a project that we did looking at 10 years of death investigations involving Native American victims in the state of Wyoming. In addition to conducting that research and looking back at past cases and opportunities for either reinvestigation or use of perhaps new techniques, we additionally solicited public input in the form of outreach efforts. We ran tip lines, did public forums for a period of close to 10 months. That information was received and then reviewed with our investigations. So that was sort of looking back. And then in the kind of current posture, we leverage our Safe Trails Task Force resources to respond to any new incidents involving missing and murdered Indigenous persons. We leverage those partnerships, as we've kind of touched on earlier, to cover responses to those critical incidents where we might need additional resources or cover multiple jurisdictions. Additionally, we will bring in personnel with particular expertise from other FBI offices. So we have oftentimes brought up our evidence response team who can provide detailed crime scene processing. We've brought in tactical components when it's necessary for search warrants and advancing some of these investigations. And then looking forward, we expect to have additional resources coming to assist us this summer in the form of temporary duty assignments as a part of the Operation Not Forgotten initiative. These are agents who will serve with us for 30 to 90 days, doing a variety of tasks to include revisiting past cases, new information that the public may bring forward, and responding to ongoing reactive incidents. Barring any questions, that's it for me.
Good afternoon. My name is Kara Chambers. I'm the Director of the Division of Victim Services within the Wyoming Attorney General's Office, and I chair the Governor's Missing and Murdered Indigenous Persons Task Force. I will try to keep it similarly brief, but I actually wanted to start with my main role because there were some comments about victim services that came up under the last topic. So you're aware the Division of Victim Services houses both the Crime Victims Compensation Program for the entire state, and that covers victims of federal crimes. So that would work with any victims who are tribal members or any crime that occurs on federal land, whether it's on the reservation or any other federal land, quite frankly. And with that, we work very closely with our federal victim witness programs, and I wanted to highlight those for you. So we have Vivian Swallow, who is the victim specialist for the BIA. We have Terry Nave, who is the victim specialist with the FBI. And then we have two individuals, Heidi Mason and Vicki Powell, who are with the U.S. Attorney's Office. And then we work with Devaney Buffalo, who's actually with the National Park Service. And that came to highlight when there was a mass violence incident in July 4th of 2024. At any rate, I just wanted to let you know that the state routinely works with our federal partners because, again, there is only a state victims compensation program that works for Wyoming, and there's a program just like ours in all 50 states. So I wanted to connect those dots for you. So there's a lot of overlap, which is why I chair the MMIP task force. And to that end, I wanted to give you a brief update. We had hoped to have our 4th annual update for the 2025 to our statewide report. It's been delayed. There was some issues with getting some death certificates certified, but that will be rolling out shortly. And we will make sure to disseminate this to the committee and the public as a whole. As you know, that's been the major push of the governor's task force is to supply data to these questions that you have. And I wanted to comment on Chairman Posey's comment about we need information, and we agree, and we need good information on what crime is actually happening, who are the victims, and where are the trends headed. And so I wanted to segue that into an offer that I wanted to make. One of the main, so when the task force was initiated in 2019, there was really a lot of public outreach and a real effort to engage the community to hear from those affected by the MMIP crisis, because certainly the state wasn't going to come in and try to lead the charge or drive the bus. We needed to hear from the community. And I think we've done that quite well. And in fact, I hope you'll hear later today from two of the Indigenous-led organizations that are here and very active. We have MMIP Windriff and we have MMIR 307. And so since those two entities have really come in to fill that in-person role, the task force has really stepped back and taken more of a public policy, legislative discussion role and data. So to that end, I wanted to offer any research requests. One of the things that the task force does every biennium is we enter into a contract on behalf of the Missing and Murdered Indigenous Persons Task Force with the University of Wyoming Survey and Analysis Center, who of course are responsible for the statewide report, to generate various reports. I know they followed up with Chairman Posey on some questions you had about juvenile crime, and that's an offer that is open that Dr. Grant, who's usually my partner in crime but is not here today, but watching online, I hope, has made. And so if there is something that you wanted to touch on, please bring that to the task force attention through me, through Dr. Grant. We're happy to discuss that. I also have a note, Senator Case, about your PSI question and the PSR, as it's called on the federal level. That might be a separate offline discussion, but those are the type of conversations that I feel that the Division of Victim Services and the Attorney General's Office can help facilitate, because obviously we work with all the law enforcement agencies in the state, both local and state and federal. And to that, I'm just going to turn that over to the rest of my count. Dara's pointing already to someone else, but we'll skip over Dara and we'll go to.
Chairman Posey, members of the Select Tribal, I actually wanted to just introduce the liaisons that the Northern Arapaho tribe assigned, which is Dara Jefferson. She didn't get to meet with you last time, so she'll give you a little bit of quick history. And then we also have Christy Wildcat for the Northern Arapaho tribe. So there's a lot of background work that we don't talk about and that the council assigns to them as well as the state to kind of keep this issue going. But again, they have a million different things going on. So here's Dara. I'm just going to throw her under the bus right now.
My name is Dara.
Dara, oh, Dara. See, I do this. Dara,
yeah, it's Dara like Sarah. Yes. My name is Dara Jefferson. I'm Northern Arapaho MMIP liaison. But I'm also the executive director for the Tribal Victim Services that falls under Wind River Cares. So the first year as liaison, I was just kind of getting my feet wet and figuring out what's already in the state. There's a lot going on. I really do gotta commend Wyoming for having a lot of different things in place, but also for both of the tribes for initiating those liaisons and having somebody speak for the tribes on their behalf. I feel like it's worked really well. I've been able to collaborate with everybody here at this table on different things, especially in the more recent months with teen dating violence awareness event that'll be taking place next week, but it's not public, so we're not gonna really talk too much about it. But it's been a great collaboration. I feel like there should be more things like that for the task force to take on because there's so many different aspects, and I know Ms. Wagon touched on it that lead into MMIP. So I work with victims of domestic violence, sexual assault, human trafficking, stalking, and then families of MMIP. And so you can see all the different connections from each of those issues and how it connects to missing and murdered people. I always say the only difference between the survivors that walk in through my door and the people who are missing or have been murdered are that my survivors are here to talk about it. So they're able to tell their stories and we're able to learn from them what they've experienced. I think there's and I know I've heard it all afternoon, the connection to, or the talk about healthcare funding and how that's important, but that's important to our victims too, and how it leads into MMIP, because a lot of our victims come to us through the clinics or through the hospitals or through behavioral health, or else it's, if they do come to us not from one of those areas, then we take them to there. If they've been strangled, if they've been beat up, if they've been raped. So we have sane nurses within Wind River Cares. We have all of our physicians and our staff. And so all of that kind of ties into each other on the prevention of MMIP. So I think it's important to mention that part too, on how healthcare funding is really integral to keeping our victim services going, because we do fall under Wind River Cares. And then I wanted to talk about I guess and I know Ms. Wagon touched on it too, and I'm sure if Carol is going to be here, I'm sure she will too, but the need for consistent reporting. I know the different agencies have their different kind of reporting. I know there's the missing murdered unit out of Rapid. Bobby Olson is really easy to reach when there's a report coming through, but when you need something to happen really quickly on the ground, that usually takes, so MMIP has started as a grassroots movement, and it kind of continues to be that, because families reach out to Ms. Wagon, they reach out to me, they reach out to Christy, I'm sure, and the Shoshone liaison, and I'm sure they reach out to all these different people who have been designated as speakers for MMIP, but trying to find a consistent reporting to where it gets out there fast. And so social media is always often relied on to get pictures out there, details out there, numbers and stuff like that. So I feel like that's going to be my focus for this coming year. After I've learned who all the people are that's working in the state. We got great advocates that are on the ground doing their thing. And I think it's really going to be collaborating with everybody to figure out how we can get it done faster at a local level. Because I mean, all our agencies have really good work going on, but it's just trying to get it immediate, in the local level. So that's kind of the update for me. Thank you for giving me the time.
Yeah. Mr. Charles?
Good afternoon. I'm James Charles again, Tribal Liaison to the Eastern Shoshone Tribe out of Governor Gordon's office. I'll keep it real brief. I would just like to say, that the governor does fully support MMIP. by creating the task force. And they do a lot of good work. I'd also like to introduce Shay Jimerson. She's a tribal liaison for the Shoshone Tribes MMIP task force. So she's a little shy, so she's very new at it. So we just wanted to give her a shout out. Thank you.
Chairman Posey,
Yes.
online we have Christy as well, and she might just, she's had quite the experience this month, so she couldn't be here in person.
Good, Ms. Wildcat.
Am I good to speak? Perfect. And I'll keep it brief as well and straight to the point because I know y'all have had a long day. But good afternoon, Chairman, members of the committee. My name is Christy Wildcat, and I serve as a tribal liaison for missing and murdered Indigenous people for the Northern Arapaho tribe. And like Anita did mention, I do want to send my apologies. I'm not able to attend in person as I'm currently injured, and that's cannot travel due to limitations with that, but I'm just honored to be able to speak today and provide a quick little update on our ongoing efforts to really address the violence that happen within our communities, but also strengthen prevention, the response systems, and support of survivors and families. So with that, first, I'd like to highlight our recent planning on the youth-focused prevention work, which is the Teen Dating Violence Awareness event that will be held on Wind River Reservation and surrounding communities. The whole purpose of this event is to really bring together students, educators, advocates, law enforcement, community, and state leaders all together with the signing of our proclamation, recognizing February as Teen Dating Violence Awareness Month for the state of Wyoming. And a little shout out to Governor Gordon for being really supportive in this movement and for everyone that has really planned for it. It's really beautiful event to see what's going to come forth. But this proclamation really represents a important public commitment that is not only by our tribal, but also our state leadership to really recognize and acknowledge the crisis of missing and murdered Indigenous people, but to really stand in solidarity with the survivors and the families when they go through this. But we really want to, take it on by taking this preventative level. So hopefully it doesn't get to MMIP. But symbolically and practically, this action affirms that the tribe does recognize this as a priority and is really committed to continue this action. And another little update that I'd like to report on are a couple of cases and concerns that were brought forward to the members of the task force by different community members. Some families did approach us seeking assistance, guidance, advocacy in navigating, law enforcement systems or service providers. So when we're approached by the outreach, we were able to help, either provide names or services or just simple phone numbers in other states or connections. And so we were able to help the family in that sense. They really did come really out of the blue, but hey, it's what the task force is there for. And so while confidentiality does prevent me from sharing details in this setting, I just want the community to know that in these interactions, it really does underscore the continued need for coordinated, trauma-informed, and culturally responsive responses across not only tribal, but state and federal systems. But I'm just a repeating record. We all know that. But finally, I'd like to speak to the importance of fully implementing a Violence Against Women Act project or a VAWA project within our tribal systems. I sit on the board for that, or the planning committee. Not fully sure what our full proper term is. But yeah, we're definitely in the early stages of kickstarting that work. So right now we're just identifying the gaps within jurisdiction, services coordination, all the planning stuff. But we're really exploring how we can expand beyond tribal authority under VAWA, but also how we can be operational to be better and better protect not only Native women, but children and all community members, since VAWA does affect all of us. But this really does include strengthening partnerships with tribal courts, law enforcement, advocacy programs, social services, the whole shebang. But not only that, as well as ensuring our community and making sure that the community is informed about not only the rights, but also the protections that fall under VAWA. So our goal is not only response, but prevention, accountability, overall healing. So with implementing VAWA in a meaningful way, it'll allow us to really assert our sovereignty, protect our people, create safer futures for the upcoming generations, and so on and so forth. So thank you for the opportunity, for letting me speak, even though I'm virtual. I'm grateful for the committee's continued attention to the crisis of MMIP, and thank you for your support for the work that's being done of this wonderful team that we have here at the table, and especially on behalf of the Northern Arapaho Tribe. But yeah, if you have any questions, I'm more than happy to answer. Thank you.
Thank you, Ms. Wildcat. Is there any questions or comments from the committee?
I wish Miss Wildcat a speedy recovery. She was very eloquent, and all of you did a great job. Thank you. Do you think we're really making progress?
Chairman Case, I do. I think the awareness is definitely out there. I think, 10 years ago, I don't think you would have heard that phrase, MMIP or MMIW. Well, maybe not as ubiquitous. I'm sure that Indigenous communities are very familiar for a very long time, but I think your average citizen in our state would not have known about that quite as much as they do these days. And so I do think we're moving the needle. The data would suggest that we're moving the needle. And I think the mere fact that we are collecting that and publishing it and making sure it's aware. And if anything, one of the things that I think really moved the needle with the first report was commenting on how these cases weren't being covered. And I think they are now. I think the other thing that came out of this was a forward-facing missing persons database with DCI. And so that's updated in real time. It's forward-facing. People can search that. I can count the different legislations that has come out of this, the Ashanti Alert, the cold case pilot project out of this committee, the missing persons legislation. I do think we're moving the needle. So thank you.
Yes, and I'd like to mention that I had a personal case recently, and I talked to Carol, and then I also talked to Nicole, and Nicole really steered me in the right way with the MMU portion of the BIA that have been really helpful, and it's opened doors. So I'm very grateful for the work that all of you do, and I'm very appreciative. Thank you.
Chairman, if I might point out on the MMU, there are only about 30 some odd in the entire nation. I know it was up from 25, but I want to let you know that Wyoming has exactly as many MMU agents as the state of California, which is one, but that speaks highly of the work that they're doing for this community.
Okay, public
Mr.
comment
Chairman.
or?
Nicole Wagon here for public comment, Mr. Chairman, and all the representatives. And first, I'm just going to give you guys t-shirts, compliment from MMIR 307, and I'll let Eastern Shoshone liaison, Miss Shay Jimerson, go first.
I'm Sherilyn Jimerson. I'm the Shoshone Tribal Liaison for MMIP. And I just wanted to, I was really impressed with Lance 4 Stars on the system they have going on. It's something we need to really do. But when a Native relative goes missing, families often face confusion about jurisdiction and whether a report was received and if agencies are sharing information. And these delays are they're not procedural, they are consequential. And the solution is straightforward. And that is we have to establish a shared case intake system for MMIR that can be used by all relevant agencies. When a report involves a tribal member or a reservation adjacent location. At minimum, the system would log reports in real time, immediately flag MMIR cases, and identify the lead agency, and prevent reports from being lost or duplicated so that families are not passed between jurisdictions. This does not require replacing the existing systems. It can begin as a secure shared intake portal. It could be piloted here at Wind River and then expanded statewide. MMIR cases require speed, clarity, and coordination. A shared intake system is not about authority. It is about accountability and saving time when time matters most. My intention is not to assign blame, but to advocate for a structure that honors the urgency of MMIR cases and the sovereignty and dignity of the family and the families involved. Wyoming has the opportunity to model a coordinated, respectful, and effective approach, one that saves time, builds trust, and ultimately saves lives. I would welcome the opportunity to participate and help convene a discussion focused on building this framework collaboratively. And I urge this committee to support development of this framework and request formal interagency cooperation to move it forward. I would like to thank you all for your time, service, and consideration of this critical issue.
Thank you, Ms. Jamerson. Is there any questions or comments?
Thank you, Ms. Jimerson. Did you have a question, Ms. Ottoman?
He's the chairman.
Oh, she was waving her hand, I'm sorry.
No, I don't think there's any. Yeah, okay. Representative Ottman.
Excuse me, Mr. Chairman, Ms. Wagon. Asking for this from the state, for the state to do something, and because it is a problem across the reservation, the county, the state, everything. But have you, is your tribal government working on collaboration and like a streamline across there? What did you call it? Shared intake?
Yeah, sure.
Thank you.
No, they are not. And I was hoping to connect with some of the BIA officers, but I haven't seen any here today. But yeah, I would like to reach out, and maybe you could point me in the right way to who would be the people that I need to contact, because this needs to happen yesterday.
We'll ask for public comment at this point.
As a public, on the public comment, again, Mr. Chairman and all representatives, I applaud your time, concerns, and with the efforts of coming together for this epidemic crisis. I've been going at it again since 2019. My daughter, Jocelyn Watt, was murdered January 4th of 2019. I can share with you that Governor Gordon reached out to me, personally invited me in the initiative of the task force. I also would like to share that I applaud him as a leader, governor, empathetic. I still have his handwritten letter to my family that's framed in my house. When a good leader empathizes and takes time out of their daily time to sit down and write sincerely of being in his thoughts and prayers for what my family has endured. That was in 2019. Again, I've been at it ever since. Also, this is my daughter, Jade Wagon. She was murdered in 2020 on the reservation. So Jocelyn was in the state jurisdiction of Riverton, Wyoming, and my daughter, Jade Wagon, is considered a cold case, 6 years too long at this moment. What drives me is her 2 children. Her spirit lives on to them. I believe you guys have probably met my grandchildren throughout. They're always usually with me. Malaya and Raphael see here. So they're always at all the marches and trying to be preventative, trying to be proactive, trying to educate the community, empower our victims and families to advocate for their loved ones. MMIR 307 is established to cover both tribes of the Wind River. We do have Eastern Shoshone on here, and we do have Northern Arapaho. We go at it hard. It's all volunteer. Ms. Shea sits on the board, and Ms. Cassandra sits on the board. The difference is with our board members, we all have somebody that has been murdered. So our hearts are in it, not by choice, not by choice, but we know what the family goes through, experiences, and respecting the families when they call us for a call of action, even just to hold their hand when they're sitting in the courtrooms, because I've already had that experience. Again, for people who were arrested for my daughter, Jocelyn Watt, that's many, many, many cases where the wounds are opening up. And I like to remind everybody, when this happens to families, they are the victims. You know, nobody has any right to take anybody's life, period. There is no middle. So with that being said, making a difference, trying to get onto the preventative side, doing something about it with all the components that are factors with the missing, murdered Indigenous relatives. I'd like to note that I am the organizer for MMIP Wind River. I stepped away from that group and came up with missing, murdered Indigenous relatives to cover male, female, and the two-spirited. This is happening to our men. I think that needs to be noted. And we came up with relatives to cover everybody, to cover both tribes. And our focus is to have a strong foundation. And I applaud the efforts of the liaisons. They just now started, I think, 2 years prior. But with elections and we have new leaders, my focus is liaisons are going to come and go. There'll be new ones coming on in. And so our focus is to have a strong foundation. And I like to share with the city of Riverton, investing into our cause. They bought and purchased our MMI Indigenous relatives flags. We fly them at every event. So I'd like to share that with you, that we're out there with every event that we're doing to make that difference in embracing our neighbors. Again, I'd like to thank the Action Committee because we did come together to have a vigil for Renee Good. She lost her life with being murdered. So with that being said, this is a tough subject to talk about. It's very traumatizing, but it affects everybody. It's got no color, but at the same time, we need to do something about the reservations and what's coming in within our communities, because it's really hard to have anything break through on reservation lands. So we need to change that stigma, and I applaud the task force efforts with all their data and UW, because all their data, I share at every event, every testimony, and it has made a huge difference of everywhere I travel, everywhere I go, or everywhere I'm asked to speak out on these issues and speaking through experience. So I thank you all.
Thank you, ladies. And if there's any more comments on the MMIP or MMIW, if not, we're going to move on to our last subject, and that is our on our agenda, juvenile justice. So whoever wants to come up front, please come up front. We'll go ahead and have everybody introduce themselves, and whoever wants to take the lead, please do so.
I'll start since it's down here. Good afternoon. I'm Hattie Calvert. I am the Assistant Director for Juvenile Justice Services of Fremont County, formerly known in the community as Youth Services.
My name is Sage Goff. I am the newly appointed Director for Treatment Courts of Fremont County and the Director of Youth Services as well.
My name is Shelly Ann Bonu. I am the Director for the Northern Arapahoe Department of Family Services.
Good afternoon, Chairman and Committee. Can you hear me? Good afternoon, Chairman and Committee. I'm Marie Muslim. I'm the Interim Chief Judge for Wind River Tribal Court.
All right, well, I guess I'll get started. So Youth Services is the diversion level supervision that is provided to the county. As part of that, we also have a day reporting center in which court-involved juveniles who are also struggling potentially in their home school districts or coming in and out of placement. It could be residential treatment centers throughout the state, the Wyoming Boys School, the Wyoming Girls School. They come through our program in order as like a step down kind of to get back into their home district. Well, at day reporting, they stay enrolled in that district, their home district, earning credit towards graduation with that. That's a really cool program that we have. Currently, we have 3 students. Semester just started. We take no more than 12, and we usually always fill up. Every semester we fill up. In 2025, Youth Services processed 258 misdemeanor citations that came through our office. So I guess the process of that is anybody who is under the age of 18 that receives a misdemeanor citation, also at that citation gets a referral notice to come into our office. We do an intake on them and then bring those recommendations to what is called the Single Point of Entry Committee. And then those cases are dispersed either through diversion or cases that meet the threshold of the juvenile court, the district court. That's where those kind of decisions are made. One big thing that we notice a lot it's kind of been a topic of conversation that I've heard this afternoon is drugs and alcohol. We had 147 drug and alcohol citations that we processed, including 5 DUIs. That's 56%, and that's about normal. I've been at Youth Services for almost 10 years, and that drugs and alcohol are always our biggest referrals. A big problem with that is we don't see a lot of what would be considered like normal teenage experimental drinking. We see drinking that is far beyond that. Our blood alcohol contents are major cause for concern that we see. Our other major citations are the next highest number of citations that we processed was 36 citations of against people. Those are like fights in school and that kind of stuff. So there's a big gap there in citations that spread across and part of that is there's not a lot of access to treatment. Unfortunately, by the time citations have been issued and families are in our office, things have been not going well for a while at that point. We refer a lot of families for counseling service, substance abuse services. We do have access to GPS monitoring systems that we use in extreme cases. A lot of those cases that rise to a GPS monitor house arrest situation are because the individual is running away, taking off, participating in those high-risk behaviors, and that's our big purpose. We don't want anything to happen to our kids, so doing what we can to keep them safe when they're with us. We do monitoring of urinalysis tests, all those kinds of normal supervision kinds of things, but we are really service oriented and referring families and kids to services. We don't have a lot of punishments. We're not punishment oriented. You know, jailing juveniles is not a good practice. It doesn't always turn out. And we don't have a juvenile detention facility in Fremont County, which makes it that much bigger of an issue. You know, and that causes a lot of, problems in that if a kid does rise to the level of needing to be detained, they're held in the Fremont County Detention Center in isolation, in booking. And it really is just not an ideal situation for anybody. It puts a lot of strain on the detention deputies and the detention center. And it really is not healthy for that juvenile to sit in that cell like that. Unfortunately, there are certain instances that do rise to that where detaining the juvenile is safe, to keep them from, you know, participating in other unsafe activities and things of that nature. We work well with the Department of Family Services, both state and tribal. You know, we're constantly talking with them. They, you know, that we are where they enter, and then, you know, some of these kids get passed on. We have to, you know, work well with them as well as the tribal court. I think that's all I have.
Thank you, Ms. Calvert.
So within treatment courts of Fremont County, we have both an adult treatment court and a juvenile treatment court. Both courts, you have to enter those services through a court order. So with our adults and our juveniles both, it's a high needs, high risk individual. They have been ordered as a part of a probation requirement. For the juveniles, it's a condition of a delinquency or a CHINS petition. And so within treatment courts, we have counseling services. We offer those IoT groups, step down to prevention services. We have case management for life skills. Within our juvenile system, we really focus on the family unit more than just that individual juvenile to help the family as a whole. And so that is kind of a difference with our adults. We, as Ms. Calvert said, work pretty well in coordinating with state and tribal DFS offices, along with the courts. So there is not a lot of services in Fremont County, but we try to utilize them all the best that we can and coordinate with one another in trying to navigate what entity, what agency can benefit the people of our community. Currently, within our adult treatment program, we range about 20 individuals that are getting those services with us. That program is designed anywhere from 12 to 18 months of treatment, counseling, case management services. Within our juvenile system, we are anticipatingly waiting funding requests from the judicial branch. And so we've got those applications in. We currently do not have any juveniles, not because there's not a need. I lost a therapist position, and that has been very hard to replace and fill. Unfortunately, without a therapist, I don't have the services available to provide for the community. And so that we've tried to become creative within youth services of meeting the needs of these juveniles, hopefully before they get to the need of treatment courts. And so Ms. Calvert and I have been trying to work on restructuring some of the youth services aspect to get in front of and start some of those prevention efforts. I think that's all I have.
Thank you. Shelley?
Thank you, Chairman. Can you hear me? Is that better? Okay. I'm gonna walk through the whole process. I have a really awesome lead probation officer that helped me put this together, so I'm gonna go through it and I'm gonna use it. The process starts the citation and jurisdiction. We're talking about Lander, Riverton, and Wind River Tribal Court. All of these juveniles are cited in Lander, Riverton, or Wind River Tribal Court. And if it happens in Lander or Riverton, it will go through the single point of entry committee, the spec committee. The spec committee then will process, and that consists of the school district's youth services, prosecutor's office, and the tribal and state DFS. They will then decide if that is diversion probation or delinquency petition. And then from there, if there's an arrest and detention, that will happen for severe crimes, felonies, violent felonies at the officer's discretion. What is diversion probation? Program overview is diversion probation for juveniles is typically for first-time offenders or low-level misdemeanor crimes. It is completely voluntary decision made by the child and the guardian, and diversion is only provided for juveniles currently with youth services at Fremont County. The process and terms, the child and the guardian reports to youth services for an intake history and circumstances, things like that. They decide on a 3 or 6 month voluntary probationary term. The child and the guardian sign a contract to complete the diversion probation. The child does not have to go before a judge. If there's a successful outcome, and they stay out of trouble, they follow the terms, they will be released from probation and their citation is declined with prejudice. If there's a delinquency petition, SPEC recommends the following, decides if the petition is needed, Fremont County Prosecutor's Office files, and a hearing is scheduled to start the process. Automatic petition, if the juvenile is arrested, they will automatically receive a delinquency petition and must see a judge within 48 hours of their arrest. And as Ms. Calvert mentioned, the detention location is the jail. You know, these kids are already feeling like nobody cares about them. And so what do? We shove them in a corner, in a jail cell by themselves, and show them exactly what they're thinking. Wind River Tribal Court process. Citations on Wind River Indian Reservation go directly to the tribal court. An ADF attends on Wednesdays. Prosecutors decide on probation or community service. And if they are ordered to go through the process, they are ordered to immediately go to the NADFS office and start the intake process. Once the case begins, the NADFS probation officer schedules an intake with the juvenile and the parent guardian to receive all information and history. They do case planning and goal setting. They set their target goals for the juvenile and family to accomplish while on probation. And something that Ms. Calvert mentioned is very crucial is that we have that family buy-in, family guardian buy-in. Some of the services that we offer are substance abuse, but as been noted here, we hardly have any substance abuse facilities locally. So our children are getting sent elsewhere to get their substance abuse treatment. Whether it be a residential, we do have some intensive outpatient locally. We go through mental health with them and victim services if that's also needed. Something that we're looking for in the future with NADFS is we are going to start offering moral recognition therapy, MRT, locally for our children. And we are going to start engaging our children in cultural events to help them through this slump. We're going to show our kids that we care about them and they don't need to be sitting in a jail cell by themselves thinking that. And tribal diversion program, we are trying to develop a specific program for all of our Northern Arapahoe Department of Family Services children. Since June, we have had 67, June of 2024, sorry. We have had 67 juvenile probation cases. Currently, we have 37. 6 of those are through the tribal court and 31 are through the district court. And this last little slide is kind of just a little eye opener. We have June of 2024 here. And you can see the increase and we kind of top off.
What are the numbers on?
The numbers on the side start here at 0, 10, 20, 30. These are kids that are in treatment or in facilities. Yes, sorry.
Sure. All right, Chairman. First, I want to build off of what they've already said is there's a need. We have a need for our juveniles, whether that's on the reservation or off the reservation, in the state, in our county. There is an overlapping. I got to set in on a few other sessions this afternoon, and there's overlapping of jurisdictions across the board with healthcare, with law enforcement, with juvenile justice, with child protection. This isn't just a reservation problem, and this isn't just a state problem. This is an overlapping issue, and our children should not be seen as problems. We should invest in our future because they are what's going to cut our recidivism, and they are the ones that we're building to replace us all. There needs to be investment in their future. The solution is not to send our children off. It's not to send them to the boys' school or girls' school. As a judge, I find that as my biggest failure when I get to adjudicate them to go away from their home, and I get to reiterate that no one wants them, that they have no place in our community. That being said, we have workers who invest and they go above and beyond, whether that's their 8 to 5 and they get called in, but there needs to be a buy-in. And there's plenty of people that are, give me money, I need money for this, I need money for that. And they all do need money, but our children is where our investment should be. We need to look at facilities for our children locally, not just our county. I'm sure every county is having this issue of where do we send our juveniles? On the reservation, when our juveniles are detained, we send them either 14 or 8 hours away. If there was a juvenile facility locally, do they all need to go to jail? No. But as they stated in the jurisdictional session, we are having our juveniles federally indicted. That is a failure on all of us, that we all share that burden because services were not met for these individuals. There needs to be productive brainstorming on how we secure funding across the board that benefits not only the county and state, but the reservation for juvenile holding facilities and for treatment facilities. I've always had a stance. I went to Laramie at the University of Wyoming, where I interacted with Chairman Posey, and I worked at the youth facility there, the Cathedral Home. They got put there and forgot about. Caseworkers didn't come see them, juvenile probation didn't come see them, family forgot about them. They were just court ordered there for years, at 11 years old, 12 years old, and they brought culture and tradition there. Luckily, my uncle would go and sweat with them and have their culture brought to him. But it doesn't help to remove the child from the environment and fix them and then bring them back to the same environment. We need to address the family as a whole. So, we need to put away these imaginary jurisdictional lines and say, how do we fix? And what do we do to address our juveniles? That's my only spill.
And that was my uncle too, not just hers.
Is there any questions, Representative Altman?
Thank you, Mr. Chairman. If you wouldn't mind, could I please have your names again and your position?
Hattie Calvert. I'm with the Juvenile Justice Services of Fremont County.
Okay, just a minute. Okay.
Sage Goff, Director of Treatment Courts of Fremont County and Juvenile Justice.
Shelley Mbanu, Director for the Northern Apple Department of Family Services, MBONU.
And I'm sorry, what did you say, Shaylin?
Shelley.
Shelley?
Yeah.
Maria Musalem, I'm the interim chief judge for Wind River Tribal Court, MUSALEM.
Thank you.
Well, that was a lot of information. That's really relevant to juvenile justice. I know last month we had a meeting where many of us were there with school superintendents of Fremont County, and they touched on the lack of deterrent in younger people. And I understand, Chief Judge, that we do have an obligation to look after our young people. But, you know, like when somebody goes to treatment, they say they don't want to put them back in the same environment. So if that environment's toxic, what options are there? And I shouldn't say toxic to the juvenile, you know, if there's a substance abuse or abuse in general, how do you guys gauge that in terms of sitting on a bench or your other duties?
Go ahead. Right, Chairman. So,
One of those microphones on.
okay. So Chairman, from the bench, and just for background history, I've worked at Northern Arapahoe Department of Family Services as a juvenile probation officer. It's where I met Miss Calvert. I've worked there as a case manager. As a supervisor, I've worked in adult probation and associate judge, and now my interim. So I've been there through the treatment facility side, through the DFS side, through the probation side. I've actually had this conversation with a former BIA is that I've seen some of these individuals at every job I've had, they followed me, whether they were at Cathedral Home and then coming back and their children were being placed in protective custody, then adult probation, and now I'm seeing them as a judge. And that just shows, you know, the recidivism, not just on the reservation, but across the board. And we have to heal our people. I can only speak for on the reservation and how I address it, but it's a work, and people need to be invested in our people. You know, as Shelley had said, like our uncle, it was that we got to get back in touch of where we came from as a people. We got to get back in touch with our culture and our tradition. And that's what I push on the bench, is to return to our culture, to return to our tradition, because we could send someone, statistically, they can go to treatment 8 to 10 times. And unless that person is wanting to change. I had a staff meeting this morning with the court, and that, you know, unless they're invested in their own life, I can't care about their life more than they can. None of us can. But we can give the options. Us in tribal court, we work with our wellness court for our adults, and we are working on establishing our youth wellness court again so that we can bring the family in. But the barriers, Councilman Glick had said it earlier, transportation is hard. We have to issue warrants for parents that don't come and bring their children to juvenile arraignments. The odds are stacked against them. The general per capita and income guidelines on the reservation are far less than across the board in the state. And we can pretend it's a reservation problem. But a lot of the clients, the 64 cases that Shelley talked about, the cases Hattie talked about, they're in both courts. They're wards of our courts, but they're on probation in district and county courts. So I retain jurisdiction because those are my kids. Those are our children. And they, as a ward, they need to belong in our court, and they've all heard me say that. But we need to work together to heal the families. So a treatment facility alone will not work. But a treatment facility that is a juvenile and adult, where parents can go to counseling and we can integrate culture and tradition, that may be our solution. But we need to address it as a whole rather than this is the kid's problem. The kid learned the behavior from somewhere. We're a broken system that's created broken adults, which now is creating broken children.
And just kind of to that point too, you know, there is kind of a point where communities feel like we can't help anymore. But I do think that it's important to understand not great things always happen in placement. Trauma, there's a lot of things that go on in placements that don't always allow for a healthy environment to help let these kids get healthy. So I think you know, we have to help our community in our community. I think that is the position of youth services and these guys up here with us. I mean, really trying to, I mean, we want, a lot of our families are going to stay here. These kids will become adults in our communities. And giving them skills to be healthy is the only way we're going to get any of this fixed. And creating healthy family units, creating a healthy community. I mean, when we're sitting here and we're talking about having drug and alcohol problem in our juveniles and in our adults, we need activities for our kids. Our kids need something. We don't have anything for them to do. A lot of communities around the state, they get to lean on a rec center. They get to lean on, an established programs of boys and girls clubs and VO. Like they have all these other resources that come together and really talk at the table. And Fremont County is lacking that. And it shows in 67 cases. It shows in 258 citations. And, access to services is a big gap. As they stated, there is a single substance abuse residential placement in the entire state. And if you're Native American and you get a residential recommendation, you're likely going to Washington, you're likely going to South Dakota, Arizona, California. And some of our kids haven't even left the county before. And that's a big shock to them. It's a big shock to their families, and families, rightfully so, balk at that a little bit. I don't want to send my 15-year-old to Washington. And I think that we can all respect as to why somebody might not want to send their 15-year-old to Washington. So I think that, investing in our community, investing in our juveniles it's a must at this point. Like, as I stated, the drinking and stuff that we see it's dangerous. And the last thing anybody wants is a dead juvenile.
Yes, I think you mentioned that last time, Hattie, that there was an increase in violent juvenile crime. And I understand, but the judge was saying here that it's not just the reservation. When we had that superintendent's meeting, it's rampant in schools also. And you see it in the headlines for Casper or Cheyenne, where there's a youth on youth violence, and I don't know, I hate to say that's a trend, but I understand that you're all doing your best to address those issues and make our community safer and make our youth more safe also, but this just seems like a trend that's happening. We talked about the violence bill that was discussed at our superintendent's meeting, and the superintendents felt it didn't do anything. That's my understanding, right? They didn't think it was going to accomplish too much, but I know that it's a revolving wheel sometimes, but we really do appreciate all of you, what you've done and what you continue to do for our communities, because our young people are, and like I said, there's no deterrent. And I'm kind of giving some background on myself, but when I was a juvenile, I was a model youth too, and they threw me in jail, and but then there was a sight and sound issue ruled in the 90s where you couldn't house juveniles in the same facility and stuff like that. But sometimes those rules have sometimes hurt us, and sometimes they make things better, but I think working with our young people is very important and has its benefits down the road. So thank all of you ladies today.
We have Wyoming DFS here.
Chairman, committee, thank you so much for the invite. I'm Sarah Sarelson with the Wyoming Department of Family Services. I'm the Field Operations Administrator, and so I get the privilege of having the 28 offices across the state including Ms. Neely that will introduce herself and explain her role in all of this as well. We're here to answer any questions that you have. You had an eloquent panel who really described the struggles that we have across the state. And as they were speaking and as we have continued to work on all of these, it's very apparent that being able to heal our families as units, not thinking about children as individuals who are going to send away and think that they have broken relationships and that they have to be put aside from where it is that they're going to return to or live, or we know, and there's a lot of research about keeping kids connected to the people that they know in their communities for a very long time, and we've worked very hard at trying to do that, and that we really believe that these kinds of things are best addressed at the local level with those kinds of meetings that you all took part in, and we just appreciate you allowing us to be part of this.
Chairman, Co-Chairman Committee, thank you for having us. My name is Jennifer Neely. I'm with the Wyoming Department of Family Services. We're here to answer any questions. It's been a long day, I know.
So I have a long-term relationship with Ms. Neely. She's been in this job a long time. And what is the solution for Fremont County in terms of facility needs and how would we fund it? And is it really kind of a panacea? Everybody says we need this facility and we need these services, but is that true? And if it is true, how do we get there with all the different jurisdictions and possible ways we could pull funding to have local resources so we don't have to send kids out? And I know we've talked about this a lot. So what would be your dream if you could do this?
Chairman, Senator Case, that's such a great question. And we've been hearing the same themes all day today, that everything is more complicated in Fremont County because of jurisdictional boundaries and statutory authority and different funding sources. And what works really well in Fremont County is the continued partnerships that we all have, whether those are formally structured or informally maintained. That's what kind of keeps things moving. In terms of what is it going to be that fixes everything, I wish that I had that answer. I think it really does start with the services that we're providing in homes to families at the beginning of the family when children are very young. Being able to work with children and families through our early childhood programs, through our K through 12 school programs. And then if it rises to the occasion of needing to go into the court, we have, the benefit of having a diversion program, which keeps kids out of that diversion or out of that juvenile court process. Because as a system, I think we're doing a really good job of looking backwards and learning from things that we've done nationally, collectively, that have maybe not turned out so well for children and families. I think we have a lot of things working in our favor right now. We have new databases. We have more formally structured partnerships in place so that we can share information. We still have some work to do with that. But I think it would take really evaluating who are these kids, why are they entering the system, what are the circumstances, and then maybe stepping back and reflecting on what are some things that we could do to bolster the systems that touch those families and those children earlier in their life cycle. That would be my wish, Senator. Thank you for asking.
So it's not like we could build a big factory that has all the programs and all the professionals and we could send a family through that front door and then it would work and all the jurisdiction things would go away. Native kids, non-native kids, you're just saying it's not there.
Well, Chairman, Senator, if you're offering, I'm certain that we could make good use of it. I think having something in place that allows us to provide intensive services to children and their families. I think families, we're learning this, right? Families do better receiving services in their home. They're more comfortable. Service providers are more able to understand the totality of that family's experience. So I think away is no longer our best option, but certainly providing some services when it comes to that point and having really intensive services would be incredibly beneficial. And those would be medical, I mean, it's everything that you've heard today. It would be medical services, it would be educational services, it would be prevention services, it would be law enforcement, it would be social services, it would be diversion and juvenile justice services. And we've heard this repeatedly, that sometimes the families we work with repeatedly. So understanding how can we intervene earlier and how can we do that effectively? And there are a lot of best practices programs around the country, and some that we're standing up in Wyoming as well, that need some time to kind of be vetted out, but we're getting there. I don't know what the magic wand would be, but we definitely need more services.
Thank you.
Was there any other comments from the committee? Thank you, ladies, so much. Is there any public comment?
Any online?
Two public comments,
We got them here. Thank you.
Bobby and Austin.
Yes, this is Austin Hill, a member of the Eastern Shoshone tribe, and you're talking about a lot of the youth and the system that's in place. And what I've seen and what I've known and experienced is you guys want to find solutions to help sober families, keep families intact, but it don't start in the judicial system. It don't start there. It starts in the home. It starts into giving these kids, things to do. So, because a lot of the homes on the reservation kids come from are not perfect homes. There's the drugs, there's the alcohol, all involved, but yet there used to be recreation. There used to be all these programs that help the youth to prevent that from happening. And if you look at it back in time, till present day, there was plenty of funding. There was plenty of opportunity for our youth to find other activities instead of getting stuck into the drugs, the alcohol. And so when that prevention is taken away, what are they left with? Back to the same system of falling back into the same rut. So when we're talking about when we need to change things, it starts in the home. It starts before they get into the system. So leadership should be creating prevention, having this recreation, looking for this funding for the kids so they have opportunities, because a lot of homes, like I said, ain't perfect. And, they can open up to people about things in their home and so forth, and they can, deal with that trauma, because a lot of it is generational trauma that is affecting everybody as we live. And, I think a lot of it can become better if we get the right people in the right positions, because since we started getting involved into all the politics, there hasn't been nothing for our children. There hasn't been nothing to prevent them from falling back into the same rut. And it starts with education in the homes, your culture, all of that. And that's what's grounding everybody, is our culture. The main thing is our culture, because that's what's going to identify us. That's what connects us with the Creator. And that's what's going to help heal our children. Like they say, you can't teach an old dog new tricks, but yet we can take the youth and change their mind. It's easier to do than with an older person. No offense, but that right there is.
None taken.
But that right there is, it's a showing fact that it's easier to change our youth and to guide them into a better direction instead of the older ones, because their mind is set. And to me, I just want to see more opportunity for our youth, our children, before they even get into the system, because once they're in the system, then they have to follow all these little doors they got to jump through. And as a family, the DFS on the tribe, when something happens, do they really keep the family together? Because I've been through an experience where they didn't. They pushed the family apart. They didn't want to keep the family intact. even though, you know, the problem was able to leave, they still wanted to split the family up. And there's got to be some kind of protection there for all children there so they don't fall into the system and then the family is separated. That's about all I have to say. Thank you for your time.
Thank you, Mr. Hill. Ms. Sangatsi?
I'll be pretty quick, but Bobby Shangutsi here, and thank you to Chairman Posey and the Select Committee today for hosting this meeting, because this is the most information that myself as a Shoshone tribal member has been able to access. And it's unfortunate because we do have councils that are supposed to hold meetings for all of these reasons. I just wanted to make a comment on jurisdiction. It's in place for a reason. We are a sovereign nation within a state, and those boundaries should be respected just as much as our treaty should be respected. Because if you don't respect our jurisdiction or our treaty, how will you respect our youth and our people? When you cannot identify a Shoshone separate from another indigenous community, that is a problem because we are not the same. And it is an issue because in our Shoshone General Council, we have passed resolutions where money is supposed to be set aside for our youth and preservation and prevention for them. And especially for our culture, we made one just last year for that. But it boils down to the leadership that we have present and for them not following duties. It also starts with leadership being sober and positive and not living a negative lifestyle, because that does leak into the community. When you have children looking up, trying to look up to somebody, do you want them to look up to somebody that is sitting in the bars in the weekend? Or do you want them to look up to somebody that is out in the community and expressing the culture and being involved in our cultural ways? And that is a huge, huge issue here. And also embezzlement. There has been so much money brought through the tribes for prevention for our youth. You know, a youth home wasn't able to become because embezzlement happened for so long. And so our new youth home was being affected and it was doing really good. But I'll say rumor has it, funding is missing again. So there will be an issue with that group home, and that's not fair to the children. It's not fair to the families. And so at this point, I don't know how to bridge this gap, but it does come with, I think the first thing is respect of our treaties and our jurisdictions. Thank you.
Thank you. Thank you, Ms. Sangatsi. Mr. LeBeau.
Good evening, Representative Posey, Senator Case, Senator Salazar, and Representative Ottman. My name is Wade LeBeau. I'm a Shoshone tribal member. I read a report that was done by Harvard about 2 decades ago. And when I first came back to the reservation, I was gone for about 17 years. I served about 9 total years in the military, 5 years active duty Navy, 2 years Navy Reserve, and 2 years Army Reserve. And when I came back to the reservation, I saw a lot of problems. And so I started studying it. And in this Harvard article, it talked about Native tribes across the board. And what it came down to was lack of leadership. The people that the kids looked up to weren't people who were of high standards. They were drug dealers. They were people who broke the law. And even the councils were part of the problem, because many councils have corrupted people in there. They get away with what they want. They spend the money. They embezzle. And so we have youth that are looking at the community and thinking that that is the way to do things. And I see the problem here with the councils and people in positions that embezzle and never get in trouble. They get a slap on the hand We see that in our court system. We see that in our councils. We see that in directors. And we all know that when we see these people, supposed leaders, they call them leaders. And that's what these kids are looking up to. So they think it's okay to do what these supposed leaders are doing. I'm a veteran. I believe in the rule of law. I believe that we have systems in place that everybody needs to follow. And when these so-called leaders are not following the rules, they're breaking the rules, they're bending the rules, and they're doing it for their own purposes, these kids are watching that. It's a monkey see, monkey do situation. I've worked for DFS. I've seen the problems. I have my own kids. And they need to look up to people who are following the law. And those people are in their 30s and 40s and 50s and 60s. And they need to set a better example for our youth. I need to set a better example for my kids. And if people aren't doing that, if they're letting somebody slide here or slide there because of who they are wrong. That's happening right now today. We all know there's controversy going on in the Shoshone tribe. And that's because of that. People do not follow the rule of general counsel. When the treaties were established in 1863 and 1868 for the Fort Bridger Treaty, that established the Shoshone tribe as the only treaty tribe in Wyoming. No other treaties apply to Wyoming. Right here, this reservation is only the Shoshone Reservation. The 1868 Fort Laramie Treaty does not apply here. The Arapaho do not have any treaty rights here, and that gets stepped on all the time. That mere thing right there shows other people that they don't have to follow law. They don't have to follow treaty law. What people fail to remember is that treaty law is constitutional law. It is the law of the land. It was established before the state of Wyoming was even a territory. So our treaty supersedes Wyoming as a territory and as a state, and it needs to be respected. I've learned a lot today, and when I looked at the healthcare, everybody deserves healthcare. Everybody deserves to be treated fairly. Everybody deserves to be able to have a chance to become who they want to become. And we hope that is a great person that they want to become. These are reasons that people like me join the military. I've heard a lot of speeches over the years during veteran services where people say we served and we died for people we didn't know. That's not true. We just didn't know who they were yet. I found out later in life I served for my unborn children. And I fight for them with everything. My kids are enrolled Shoshone. I will fight for their treaty rights harder than anybody I've ever known. And I stand on them because they are the established constitutional law that is their right. And I hope people start to learn their rights, because as Americans as a whole, we all have rights that we do not exercise. We need to become better examples for our children so they look up to us and become better people. Everything we talk about today and tomorrow is what is going to help mold these children into better people or worse people. And we need to hold each other to higher standards in respecting our current laws, our current jurisdictions, And yes, work together with that. But they need to be recognized. The Shoshone tribe is the ultimate authority on this reservation. That's been fought in court for over 100 years. And we've won every time. So I hope people here learn and they start to be better for their children, and that we can work together to show them how adults are supposed to work together under the rule of law, out of kindness, out of respect, and out of love. Thank you.
Thank you, Mr. LeBeau. I think as Mr. Heel mentioned earlier about the families being responsible, but one factor that's really important is, and the judge knows this as well as the director of DFS, is many of our children are being raised by grandparents. Many in my family are being raised by grandparents also. So that's another factor. Not every parent is there for their children. It's the grandparents. So we got to work on some of those types of things too, Mr. Hill. And I appreciate yours and Wade's and Bobby's comments this afternoon. And thank you for sharing those. So if there's any more public comments, we'll welcome them. If not, it's been a long day, so we'll adjourn until tomorrow at 8:30. See you later, girl. Niece.